Good evening. It's another great episode of our Dental Marketing Philippines webinar. I'm very fortunate tonight. So some other countries, for those who are outside Philippines, we are live at Dental Marketing Philippines. Ako, napakaganda pong pagkakataon nito para sa akin. We are also very excited to hear about what is the topic for tonight's presentation. So I'm hoping that you will be able to join us. You can always reach us. You can share. You can connect. You can ask questions because we do have great topic today. Lahat po ng dentists who are watching today or watching tonight all over the country, and even if you're outside the Philippines, it is very important that you should listen to this particular topic. This is a great topic which every dentist must know about. So again, we are Dental Marketing Philippines. I am Roche Peñaferte Ruiz. I'm the founder of this page. And basically, I'm here to support and help those dentists who want to attain a certain level of success, whether it's in the right practice, whether the right posture, whether in the different kinds of discipline. But basically, I do a lot of dental marketing po. Just to give you a brief overview, no, we're very lucky. As you are all excited, nakita ko na po yung guest natin, no, pogi-pogi sa ilalim. Ano? Just to give you a brief overview, we have discussed webinars since April 7. We were able to talk to the President of Philippine Dental Association. Thank you very much, Dr. Stephen Del Monte. I was able to also impart last April 10 the pandemic, its effect to dental practice and dental business. And I also share some of the inputs with Dr. Luisito Ruiz, the telemedicine. So he is a medical doctor. He's a surgeon by profession. Pero nakita po natin that in medicine, they are already starting telemedicine. And even in PGH, no, sinimulan nila, it has great results daw po, especially for those patients na positive sa COVID kasi bawal dalawin. So it's a great help that they practice dental or medical medicine. So telemedicine po ang tawag doon. Then last April 16, we are very fortunate because we were able to talk to Dr. Matthew Gillespie. No, it's, of course, you know very well that he's been in the Philippines last February. He talks about biomimetic dentistry. So nakausap din po natin siya. And then so those are the first four. Then another four. So Dr. Sonia Dunbar, we were able to talk to her, and she talks about the untold secrets of establishing a successful geriatric mobile dental program. So we know for the fact that mobile dental geriatric program in the US is really a huge market for those who would want to have a particular or want to have a lot of information about this. You can always go back to the dental marketing page and you can see all of these lectures. And also April 18, we're able to discuss with Dr. Arturo Pabia. He's the president of Globo Dent in the USA, and it talks about bleaching, everything about it, materials, cases, and technical specification. And we'll really learn a lot from Dr. Arturo Pabia. And last April 22, of course, we're still very fortunate because we do have a lot of friends who are in the dental world. We were able to talk to no other than Dr. Lilian Ebuen, and the title is COVID-19, What Can a Dentist Do to Protect Themselves and Their Patients? And we were able to get a lot of protocols from different yung pong ginagawa niya before and even after this pandemic, kung anong gagawin niya. And also we're able to talk to Ken Ko, no? He is the manager and he was able to introduce the minimally invasive implants. So I'll be carrying that particular product. Basically, just to give you a brief overview, this is a Korea base and it's a great technology. This is called Magic Core. So we're going to launch that probably 2021 na. And for those implantologists or those who want to do implants, I'm going to bring you to Korea. Okay? So I'm very excited to present this particular product to you. And last April 27, me, Mr. Malvin, Mr. Econ, we're able to discuss because dentists also, there's this level of anxiety. So we're able to talk about faith, we're able to talk about hope, and we are also able to talk about spreading love. No? So yan po yung pinag-usapan natin last April 27. And in May 4, last May 4 po, nakausap po natin si Dr. Lilian Blanco Rosario. She's a pediatrician by profession. She's associate professor in University of Perpetual Health hospitals, and she talks about the interprofessional medical and dental collaboration. So there's really a need for us to really collaborate with the medical doctors. No, nakita po natin na there's really a need, and then when is the right time to communicate with the medical world. And on May 10, today is May 7, so that's going to be 3 days from now. Of course, we're going to listen to the great presentation later. We are going to have my friend, Dr. Kevin B. Mirasol, and he will be talking about dental digital marketing, social media branding for all the dentists out there. You know what, dentists, it is my mission to give you this webinar, because also this is a right opportunity for each and every dentist to build your brand. Yes, this is a perfect time to build your brand, no? Yung branding po, malalaman nyo po mamaya. Why? Because our guest starting to build his name, and he has a very unique branding, no? He is now called the dental architect in the Philippines. So yan, malalaman natin yan mamaya. So that is how you call branding. And this is called professional branding. So it is allowed by even, you know, by even the PRC is allowing professional branding. So we'll discuss that one in a different setup of presentation in 3M's of practice management. And on May 13, probably this is going to be the last presentation that dental marketing is going to have. I'm going to discuss the 3 phases of the dental world: during, after, and the recovery period. I will also be talking, and I will also give you a tour of step-by-step procedure of my clinic, of our dental clinic, on how to accept patients. I will not be talking about the protocols, because you have heard a lot of protocols from your mother organization, which is definitely a very, very good guidelines. So I will be talking step-by-step in accepting patients up to the treatment room hanggang lumabas po. So that is going to be on May 13. Plus, I will also be talking about Kano. Kano. What is Kano? O, alam ko po yung mga dentista, sawang-sawa na ko sa HM. How much? How much? How much? No? Yan. Si Dr. Arki, nakikita nyo, nag-stress na, ready na. So Kano. So I will be talking about Kano. How much you're gonna charge your patient now, and how much is the cost of PPE per patient. So I think you've seen some presentation about this, but we're gonna learn more on May 13. But before I introduce my very special guest, no, I would just like to say hi to Dr. Ray Agcahas. Magandang gabi po sa inyo lahat. Dr. Regina Castilla, Dr. Arnel Paulino, Dr. DMD Bells from Marinduque. So we hope that you'll stay here, because we do have a great presentation today. Dr. Mirna, Dr. Margie, Dr. Presi, always there to support us. Thank you very much. If you're excited, I am more excited. Okay, so all of this webinar can be you can watch this in my YouTube channel. Re-replay po natin, and also I do have a page, and probably you can also watch this in the Dental Architect YouTube channel. So mamaya po papapromote po natin siya, ang ating guest. Okay, so allow me to introduce, no? Let us just say hi to our guest today. Okay, tonight, Dr. Arke. Magandang gabi po sa inyong lahat.
Magandang gabi po sa inyo. Okay na ba? Narinig nga ako?
Yeah, Doc, kamustahin mo naman yung mga manonood natin?
Okay, good evening everybody. I'm Doc Arki De Leon. I'm gonna teach you today ergonomics. Okay, so proper positioning, proper execution, and proper, kahit yung ano bibilhin nyo, mas magandang bibilhin para sa dental practice nyo. I will also teach that. Some part.
Kahit ako, very excited, because this is basically the basic, Doc, no?
Basic.
So we're all very excited, but of course, bibitinin ka muna namin, because I'm going to properly introduce you, Doc. Okay? So, Dr. Arke, he is a graduate of Fatima University, no? Currently, he is also a faculty of dentistry. So, talaga pong sanay na sanay ito sa camera, sanay na sanay sa radyo, because he's also a radio anchor in DCME. So, kung gusto niyong mapanood, he's also a radio anchor in DWIZ 882. And founder siya ng Fatima Dental Students Association, Denslen and Lente. I believe this is more on photography. Magaling tayo mag-picture ito, especially posterior, no? And he's also the founding vice president, no, for Biomimetic Dentistry Philippines, and currently he's board of Philippine Academy of Aesthetic Dentistry, which happens to you are going to have a lecture this tonight at 8 p.m. Then he is also, wala yatang ginagawa si Dr. Arke. Kaya mo pa ba ito? He is the president. He is the president of Pasig Pateros Taguig Dental Chapter and KOL of Boco, Germany, Upredi, Whip Mix, at Pulsar. And ano pa ba ang gusto kong sabihin? Wala na. Let us welcome Dr. the Dental Architect, Dr. Arke De Leon. Dr. Arke.
Good evening po, everybody. Okay. Saan ako kami narinig ng palakpakan? Ako na lang papalakpakan. Okay. Good evening, everybody. So, thank you for this opportunity to give a webinar. So, it's our time to share. Mas maganda po. I feel good when I'm sharing a lot of things. Kaya nga po ako that's why I became a faculty of Our Lady of Fatima University. I really love teaching. Okay, so I'll just share my screen.
Go ahead.
Okay, so there you go. Lalabas po siya. So this is dental ergonomics. Okay, medyo delayed lang yung sa cellphone.
Go ahead, Doc.
Yeah. Dental ergonomics. So what we are gonna discuss today is what is dental ergonomics? Why do dental ergonomics? Why do we have to think about it all the time? And what is ergonomic design? Okay, we will tackle everything. Kung anong bibilin yung chair, kung anong magandang instrument, paano gamitin yung instrument, we will teach that during this webinar. Okay, so what is ergonomics? So we have a balance of job and human. Okay, we have to weigh things on who to prioritize. Okay, so ergonomics is a way to work smarter, not harder, by designing tools, equipment, workstations, and tasks to fit the job to the worker, not the worker to the job. So this is the meaning of ergonomics. That's why I will always say to you during this lecture that you always have to adjust your work for you, not you adjusting for your work. Or what do we see? Do not adjust for your work, but adjust your work for you. Okay, later I will show you what does that mean. So ergonomics is all around us. Okay, it's everything. It's position, execution, and instrument design. Especially in dentistry, it is really all around us. Position is the way you position yourself. Okay, one way is the way you position yourself. Just like this one, even in standing up, that is ergonomics. Okay, if you do the noodle, the nosy, or the goose, it will strain some part of your muscle more. Okay, unlike the correct posture where everything is along the long axis of your body, it will strain less muscle. Okay, kasi more working muscle yung ibang And baby on board is actually more heavier in the front. Okay, kita na naman yung may mga ganyang medyo baby on board, what do you call this, mga may chan. Okay, those things, sometimes there was a study that if you have 10 pounds in front of you, your lumbar muscle is carrying 100 times of that weight. Okay, that's why it's more strenuous on the body. And how you position yourself during your work. Okay, sometimes you're slouching too much, or you're leaning forward too much, or you're leaning back way back, or are you leaning your position correctly? Of course, it's not just your position. You always also think about how you position your work. Okay, and look at this one. The second picture. Okay, is leaning way back. It's too far. That's why his neck is more painful and the lower back. If your work is too high from you, you tend to look up. Okay, and it will cause strain more on your neck. Okay? And you look at your hands, your arm, your wrist. Because it is bended, it's not in the natural position. That's why it's more strenuous. Okay? And sometimes if you work a little higher than your work, you tend to slouch more. Okay? And execution. Sometimes you have the right position, but your execution is wrong. You're using the wrong muscle. Okay? Just like this one. If you carry the box with the use of your legs, you'll be able to carry it easier. But if you have the right position, but you're carrying it with your back, it will be more painful, you'll get more tired, and it is not efficient. You will lose more energy than you have to be. Just like in wall climbing. Did you know that wall climbing does not use your hands too much? It's more on the legs and thigh. Okay. When you look at it, it's like parang binubuhat nila. It's like they're carrying themselves with their hands. That's why when we try it, we're using our hands. But we notice that we're getting too tired faster. We get too tired. I will get tired faster. It's because it looks like that, but the execution is different. Their hands is just for balance, and their feet, their legs and thigh is the one that's carrying them up. Okay? Yun yung misconception natin. Okay? Tama yung position, but the muscle that you're using is wrong. Okay? You should do wall climbing just like you're using a ladder. You just use your hands for balance and you use your legs more. If you use this technique, actually, wall climbing is very, very easy. Okay? Nagmumukha lang siyang mahirap. It just becomes hard if you're using the wrong muscle. You're using your hands more. Okay, instrument design, everything is designed ergonomically. Your doorknob, kung ano inuupuan nyo ngayon, what you're sitting at right now, your keyboard, your cell phone, everything, they are thinking of ergonomics when they're designing this. Its shape, its size, its weight, everything is accounted for. Okay, it exists in all tools, equipment, and furniture. Just like this one first chair, this is an ergonomically designed chair where it supports your lumbar back, it supports your neck, it supports your arm, and the curvature on the main chair, it's the one. Okay, it supports your legs more. Okay, unlike the other chair, it's not ergonomically designed. It's just flat. It tends to focus it tends to what you call this, impinge more muscle. Let's say your coccyx bone is gonna impinge the muscles on your buttocks more. So it's gonna be a painful sitting when you're sitting on a flat chair. Even sometimes in our mouse, this is an ergonomically designed mouse. As you can see, later I will show you the neutral position of the hand, and this is more close to the neutral position of the hand. Because a normal mouse is not on a neutral position. It is more twisting your forearm more. If it twists your forearm, you're exerting more force, so that's why it's not ergonomically designed. So like this scissor, okay, this scissor is ergonomically designed, so when you're using it, it's more easy to cut. Okay, that's why I don't know why our scissors are like this. This is not actually an ergonomically designed scissor, because sometimes it hurts your hand, or it's too small, it's too thin. That's the grip is not too strong. Okay, even the floor has to be ergonomically designed. If it's rough and has more grip, it's better for you. Okay, but not all the time with the grip is good. Actually, in the dental clinic, having a more grip on the floor is not good. Why? Because you have to have a smooth floor. A smooth floor will give you more advantage by rolling from side to side, changing position while operating on the patient. Even the knobs has ergonomically designed. Some of the knobs has just circular. It's harder to grip. Unlike others, has more wedges or more wedges, so it's easier. Even your shirt, do you know how to identify if a polo shirt is for a girl or for a boy? Okay, it's over what they call the rule of right over left. Okay, the right side should be over the left side when you're having your clothes on, your polo, your shirt. Right should be over the left. That's for girls. Okay. When it's for male, it is left over right. It is designed that way because if it's right over left, when we during those times, in the medieval times or old times, when they designed it, the shirt from right over left, the sword tends to get caught up in the shirt. Okay, kasi nakalabas yung right over left. Nakalabas, so sumasabit. So they change it in a different way with left over right, so there will be a smooth transition when the soldier draws his sword. Okay. So why do ergonomics? For ergonomics designs and practice, of course, well, let's see what our poor ergonomics is and what does it do. Okay, so poor ergonomics design and practices can cause vision impairment. Okay, so more strain sa mata. If you have more strain on your eyes, you'll have more vision impairment. Okay, hearing loss. Okay, of course, medyo maingay mga instruments natin, especially now that we're gonna use a evacuator, a high vac all the time. It might damage our ears. Okay, psychosomatic disorder. Okay, musculoskeletal disorder is the number one. Is the where your muscles and bones is having a problem. Okay. Next. Okay, so this is an example of a poor ergonomics. Okay, the dentist is adjusting for her work. Okay, because she cannot see the patient's teeth. She adjusted for her work. That's why she bends. Okay, siya yung nag-a-adjust. Okay. So what it tends to bend your bone. It tends to bend your vertebrae more, okay, causing more strain. Okay? The more farther the further the body part is away from the long axis of the body, the more muscle that works. Kasi parang binubuhat niya yan. Okay? Parang mas malayo sa'yo, mas mabigat. So if your head is farther than your long axis of the body, more muscles are working, more injury, and more fatigue. The delivery of dental care often results in sustained, awkward, unhealthy posture. This can lead to what we call the clump. It is chronic pain injuries, lower productivity because mabilis ka mapagod. Usually, if your position is wrong, you just work for 2 to 3 hours and you're already tired. Okay, it's low productivity. Untimely surgery. Okay, a lot of dentists is having a carpal tunnel surgery right now. Okay, and I know a lot of dentists who tends to find other means of income because their carpal tunnels already damaged. Okay, and missed work or premature retirement. Okay, our practice is what because you're swerte ka na kung nakakapag-practice ka pa ng 60 years old. Okay, because a lot of dentists retire around 50, 55. Okay, so it's better if you have good ergonomics, you'll probably be able to work longer. Pain in the back, neck, shoulders, and hands is common among dental professionals. Okay, these are the work-related musculoskeletal disorder. So kita mo yan, yung mga, this is the low back pain, okay, muscle strain, and disc herniations, yun yung mga nadidislocate yung inyong spine dahil sobrang angulated when you work. Neck strain, tension neck syndrome, so may stiff neck, okay, and forward head. Yung parang forward head is like something parang naka-forward na lang lagi yung ulo mo dahil nga every time you work, you stay on that position and then your muscles and your bones will adapt head forward all the time. And the most common and the most scary of all work-related musculoskeletal disorder is the carpal tunnel syndrome. This will make you stop working. This will retire you faster. So this is a summary of problems of our dental professionals. Okay, of course, the front office, not much on the low back, neck, or shoulder. They have more on the hand and wrist because they are writing all the time. But as of now, not much right now because medyo typing na lahat eh. Hindi na masyadong sulat. Dati kasi talagang everything is written. Assistants, low back pain. Why? Low back pain ng assistants because when the dentist works, he likes the work. He adjusts the patient's mouth that will be convenient to him, but not for the assistant. That's why the assistant tends to lean forward more, and that's why they have more low back pain because they tend to lean forward more. The assistants. Okay, and neck pain. Okay, of course, low back and neck pain. Hygienists, more on hand wrist pain because they are scalers. they scale a lot. Okay, scaling and polishing is a very damaging for our hands. Okay, I know somebody hindi pa rin bumibili ng ultrasonic. Okay, just imagine, manual pa rin. So please avoid manual scale. Avoid complete manual scaling. Okay, what do you mean complete? Yung hindi ka na mag-ultrasonic. Okay, it's good to have combination ultrasonic and manual to lessen the strain on the hands. Okay, dentist not much. This is in statistics in Denmark, and then the cleaning is given to the hygienist. Okay, and the dentist does not scale anymore that much more. So they are more on handpiece and extractions. Okay, but we are more on the still neck pain and shoulder pain. Same with the hygienist. Okay, so consequence of poor design. Okay, so consequence is discomfort, chronic pain, accident, injuries. Okay, fatigue, increased errors. Kasi if you're tired, you're in the wrong position, you tend to have more errors. So work-related muscular disorders. So these are the problems that can be caused by poor ergonomics. So low back pain, tendonitis. Ito yung your tendons are inflamed, epicondylitis, your epicondyles are also inflamed, bursitis, the one with the fluids are also inflamed because these are musculoskeletal disorder. What factors contribute to work-related muscular disorder? Okay, so these are the repetitive motions. Ito yung paulit-ulit, scale, 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 up and down, up and down, up and down. Okay, so the more wear and tear, okay, it will eventually cause disorder. Okay, grasping small instruments for prolonged period. Okay, so later I will show you the neutral position, because when you grasp a small instrument, you tend to use smaller muscles. So using smaller muscles will cause more strain. So as much as possible, when you can use larger muscle, use a larger muscle. Just like the one I showed you during the wall climbing, if you use your small muscles in your hand, you get tired more or more injury. But if you use your legs, which has a bigger muscle, it tends to lessen the load, or you can less injury. Okay, prolonged use of vibrating hand tools. Vibrating hand tools, because when you're holding a vibrating instrument or anything that vibrates, your muscles is what they call controlling or balancing the vibration, or it's absorbing the shock. Okay, parang muscles work just to maintain balance. Okay, that's why when you travel, by car, the small vibration of car causes what they call this muscle movement. Kaya even though when you're just traveling with your car and hindi ka naman nagda-driver, not the driver, after the long trip, you feel tired when you go out. Why? Because your muscle is balancing your body during the travel, and the vibration, okay, it's always there. Okay. Static neck, back, and shoulder posture. This is when you don't move on a long for a long time. You stay on a certain position for a long time. If you lean forward for a long time, your muscle is working the whole time. Okay, pulling the whole time. If you lean forward, your lower back is pulling. Okay, maintaining balance. Okay, because if it doesn't work, you will fall. So it's working all the time. If you have static position for more than 30 to 1 hour, so it will strain a lot. Okay. So these are the static neck back posture. Okay, so as you can see, it's like the neck is carrying the head. Okay, the neck is carrying the head, and I told you the farther the body part away from the long axis of the body, the heavier it feels. Okay, anything that is far from you gives more effort. Okay, more muscles to use. So yan, it causes lower back pain. Every element there. So repetitive motion, scaling, polishing. Okay. So grasping small instrument, okay, can cause carpal tunnel syndrome. Okay. So later I will show you. And this more or less, of course, dental technician also have what do you call this? They have fatigue when they're working, especially when they're using the micromotor. So that's why they suggest the bigger motor, okay, the one that is stable, the one in front of him. And when you use that, it's less vibration on your hand, but you're just holding the denture or something. Because if you're using this small instrument, it vibrate more, so it might cause more fatigue and problems. So, yan, so this is the side effect. You have poor flexibility, improper positioning, weak postural muscles. Of course, you are stressed more because you feel tired more, poor equipment, improper adjustment of equipment, and infrequent breaks. Ito yung unting trabaho mo, pahinga. Unting trabaho mo, pahinga. Yung parang ayaw mo na dumating. Pag may patient, parang, may patient pa. Oh, sige, sige. Parang you tend to, what they call this, you're not inspired, you're having less income actually. Okay, hindi ka driven. Parang may isa pang papastahan, pwede pong pampastahan, but you feel tired already. That's why you tend to, okay, next time na lang. So, low productivity, low income. So, this is the transverse carpal ligament. This is the one that's compressing the median nerve. Okay, the more work, kumakapal yung transverse carpal ligament. Kasi sobrang when you use your hands too much, especially the cellphone, small instruments, it tends to thicken the transverse carpal ligament. Ito yung sinasurgery para ma-release. Okay, so the median nerves gets compressed. When this is the tunnel is kung saan dumadaan yung median nerve. So that's why they call it the carpal tunnel syndrome. So pag naipit yung median nerve, there will be a numbness feeling. And median nerve is compressed at the wrist, resulting in numbness or pain. I will show you later a certain technique where you can decompress the median nerve. That is where you release the pressure on the median nerve. That you can practice. Okay. So this is our test on whether you have carpal tunnel or not. Okay, so this is the Phalen's test. Okay, so you what do you call this? Rested elbows on table, better without elbow flexion. Okay, reverse maneuver. So you do this position for 30 to 60 seconds. If you feel any numbness or pain, you are more or less have a possibility that you're starting to have a carpal tunnel syndrome already. So this is a way to test kung may problem ka na sa iyong carpal tunnel. Okay? If your median nerve is being compressed, this is a way to check. Okay? So another test is the Tinel's test. Okay, Tinel's. So gently tapping on the median nerve. Okay, if you have tingling in the medial nerve, more or less, you might need to check a physical therapist. Okay, careful to tap gently. Huwag na masyado malakas. So if you tap way too strong, baka naman nagka-problem na yan dahil masyado malakas ang pag-tap mo. So the Durkin compression test is where you apply pressure, okay, on your wrist, okay, for a long time, for 30 seconds or less. And if your fingers feels paresthesia or parang it feels numb, more or less, you might have a carpal tunnel syndrome problem already. So hopefully wala naman. So let's hope we don't reach this test. So if you're having a doubts on yourself, you can use these 3 tests for your carpal tunnel syndrome. Okay, so the Phalen's test, the Tinel's test, and the Durkin compressions test. So there are treatments for carpal tunnel syndrome. Okay, we'll just run it down. I'm not professional when it comes to the treatment, but there, of course, if you apply warm compress, it tends to relax the muscles, so releasing the pressure on the median nerve. Okay, wrist splint. Okay, I'm actually using a wrist splint sometimes. I actually have sometimes I have problems with my wrist, not because of dental practice, but more on the cell phone part. Okay, because almost 3/4 of our lives is on the mobile phones already. Okay, oral medications, okay, muscle relaxants, okay, that will also help. It will release the pressure. Local injection, okay, that's with the physical therapist. Ultrasound therapy, which also tends to relax the muscles, and sometimes yung what they call this, the paraffin wax also helps. Paraffin wax. Okay, predicting the outcome of conservative treatment. Of course, we don't want the surgery part. Surgery part will tend to what you call this, lessen the movement of your hand. Okay, this is a wrist splint. Okay, sometimes may metal, it has a metal inside. I actually bought one in Toby's. Okay, in Toby's, if you can, it's just around 750 pesos. Ganun lang. So, neutral position. Ito yung what is neutral position? What is the normal position of the body? Okay? As much as possible, we want to be in a neutral position as much as possible. Of course, it cannot be all the time, but when you're doing something, you always think, are you in neutral position? Okay? Or are you going away too far from the neutral position? Okay? Because if you're too far from the neutral position, you might have a problem. Okay, so neutral position, each portion of the body has a neutral posture where muscles are most at rest. So the hands, the arms, the legs, it is where no muscles or very, very few muscles are working during this position. Okay, unlike, that's the way they say, if you're smiling, you're using less muscles than you're angry. Because if you're angry, you're using way too much muscles. That's why it's more stressful to be angry rather than be happy. Okay, so it's least traumatic to the body, and when work includes repetitive or static posture, it is important to keep the body in the neutral range. If you think that you're gonna be using that hand all the time, as much as possible, place it in a neutral zone so it will not get tired faster. Okay, lesser muscle use will cause lesser fatigue. So this, according to NASA, this is the neutral position. Okay, they found the neutral position where? Of course, in the space. Okay, because there's no gravity. This is the position where no muscles are working. Okay, unlike right now, we have gravity here. This is NASA. Okay, that's why they were able to get this, because they don't have gravity on space. But here in the Earth, okay, we have gravity, so there is always muscle working. Whether you're sitting, whether you're standing, or whether you're lying down, your body is using a muscle that's balancing yourself to keep you. That's balancing against the gravity. Okay, that's why the most resting position is in the supine position, because you're resisting the gravity lesser. Okay. So that's why when you're driving, the position is similar. Okay, that's why you can drive for 6 hours without getting way too tired. Unlike when you're using a computer in a different position, you get tired more faster. Okay, you can only work on a computer for around 3 to 4 hours and you get tired. But driving, I can drive for 8 hours, but still not that really having lower back pain too much, or if you're using the proper position. Neutral hand position is not straight, it's not curved, it's not closed, it's somewhat a little bit curved. Okay, so check your hand. What is your neutral position? Okay, relax your muscles. That is what we try to achieve during our work. Okay, so proper position in dentistry. Okay, so in neutral position, as you can see, I'll just turn back. If you use a small instrument, you tend to go farther than the neutral zone. Okay, kasi this is the neutral zone, and if you work a small instrument, you're far. Okay, but if you have bigger instrument, you have less. You're closer to the neutral position. Okay, proper position in dentistry. We have macro position and micro position. So, proper macro position in dental practice. These are how you position yourself and you position your patient. So, this is the proper positioning. So, head tip forward. Okay, a little tip. Hindi naman kailangan talaga straight na straight. But a little tip is okay. Okay, not turned left or right. Okay, shoulder relaxed. Okay, shoulder relaxed or slouch. Or what do you call this? No muscles as much as possible. Torso straight, 20 degrees lean from the waist is okay, but not away, too much away. Okay. Avoid static or awkward position. Okay. Okay. So when position the patient so that operator's elbows are elevated no more than 30 degrees. Okay, I will show you a picture of that. Adjust patient chair when accessing different quadrants. Okay. Alternate between standing and sitting. So every time you can have a chance to stand, you stand. Because we try to avoid the static, long static position.
Doc RK.
Yes, pa.
Yeah.
Yes, pa.
Ikakat lang natin si Dr. RK. Meron lang mga, para makapag-relax ka muna, makainom ka naman ng tubig, pero namamaos ka ng konti, ano?
Mabilis ba?
Hindi, tama lang. So, we have so many engagement kasi ang daming nagtatanong, ang daming comment, nagpapa-shout out. So, we would just like to just pause a little bit because we wanted to greet some of the dentists who are tuned in. Dr. Ricardo Garmonton, magandang gabi po sa inyong lahat. Dr. Bravo Ragasa Abdon. Doc, may isang tanong dito. I know if you can answer this now. I'll flash it on the screen. Sir, Dr. RK, ang problema, pag gamit yung aerosol shield, naka-slouch na tayo. So what do you think about that?
Yes,
Dr. RK?
Later I will show you something about that. May nilagay din akong certain slide. Kasi, siyempre, as much as possible, ayoko nang galing sa sahig, yung aerosol shield. Kasi pag galing sa sahig, di ba may mga stand na hanggang sahig?
Yeah,
so, ang problem dun kasi, hindi ka makagalaw from 12 o'clock to 9 o'clock position. It's very difficult. So, mag-maintain ka lang sa isang position which tends to be more unergonomic. Okay? So,
okay.
Problem yun.
Tama, Doc. So, we have one here, no? So, salamat po sa mga nanonood. Keep on asking questions. So, pinos ko lang po si Dr. RK. We are not done yet. Oh, he's gonna be talking a lot more.
Intro pa lang.
Intro pa lang yan. So, we will have a lot of learnings tonight. But meron to siyang magandang ditong comment, Doc, ha?
Yes,
sabi ito, siguro papabasa ko sa ito. Tatanggalin muna natin yan. Basahin mo, Doc. Napabasa ko ba?
Hindi.
Ay, hindi. Sige. Sabi ni Dr. Carlo Luis Santos, ito, we just need your comment here. Pag hindi nagbabayad ang pasyente, Doc, bakit po lalong sumasakit ang katawan ko? Pag naman may 6 units, tapos full payment, bakit po parang walang sakit? Parang di ako pagod. So, ang sarap pakinggan yan. No? So I think it's time for us to continue with the learning. So, go ahead, Doc. Thank you. Go ahead.
So, thank you, Doc Carlos, for that question. Actually, si Doc Carlos, ang ganda ng lecture niya last time. Tawag dun, 800 yung viewers nung pumasok ako. Sobrang daming ano. So, congratulations for that, Doc Carlos. Okay. So, asan na ako? So, meron din ako pinapractice hindi lang ergonomics. Egonomics. Okay. Egonomics. Ito yung titingin ka sa salamin, then you have to feel confident of yourselves muna bago ka pumasok sa work. You boost your ego first. You tend that I can do this project, I can do a lot of patient today, law of attraction, that's where you practice everything. That's egonomics. Boost your ego. Okay, not in a bad way, okay? Just to give you confidence that's what you call a healthy confidence. So this is the good position for our elbow, okay? So as you can see, dropped ang elbow. Straight down ang elbow. Along the long axis, ang elbow talaga, ang arm. Okay? Ang arm natin drop along the long axis. Because if you go farther from the long axis, your shoulder muscle is working already. Okay? Inangat mo yan, working. Finorward mo yan, working. So as much as possible, the lesser muscle, the lesser fatigue, the lesser, what do you call this? The lesser energy that you have to use. So as much as possible, kamay lang ang buhat, elbows lang ang buhat. Okay. Everything is in the long axis. So upper arm, straight down, lower arm. Okay. Stay parallel to the floor. You can raise it a little bit, around 20 degrees, but not too much. So this is the safe area. So that's the ideal. The ideal is 90 degrees. 60 degrees is a little bit okay, but a little too much. The lesser, the better. Okay, if you tend to flex your muscles more, biceps mo, too much working na yan, it will cause problem. Okay. So this one, okay, this is the good sitting position. So the 90 degrees position. This is what we've been taught all along every time. Okay. But is it actually a really relaxing position? Can I know who is sitting like this right now? I think nobody is sitting like this right now. Okay. Do you go home when you're tired, you feel tired, okay, and then, oh, I'm so tired, I'm gonna sit, and you sit like this, 90 degrees? No, because it's actually not a relaxing position. Okay, it's what you call this, it tends to, what you call this, strain your lumbar muscles more. Okay. So, we tend to slouch more because you want to relax the back muscle. So 90 degrees is not really that good. So this one tends to go 75. So that's using more muscles because you're far away from the long axis. So let's go back to the neutral position. Neutral position is not 90 degrees. Okay. Neutral position, this one is comfortable, right? Most of you is more or less sitting like this. Okay. Or you're sitting on your bed with just your feet straight, but you have this kind of angle. Okay, you have lots of pillow at your back. That is the most relaxing position that you can have, because more or less it's in the 90 degrees. 90 degrees. What do you call this? More than 90 degrees. That's why. But we cannot do this in practice. Okay, we cannot work like this. Okay, we cannot work leaning back because we want to see the patient's mouth. That's why it would be perfect if we can have a long axis but still maintaining more than 90 degrees. So usually they raise the chair a little bit more, okay? So you will have what they call this, that 110 degrees, okay? If you have 110 degrees, that's like your, it's the same position when you're driving or you're, what do you call this? When you're driving, or it's more closer to the neutral position, if you remember the neutral position. Okay, but please make sure that your chair is designed for a 110 degrees or 135 degrees position, because if your chair is not designed for that, you might be impinging some muscles on nerves on your thigh, on this area, on the edge of the chair, that might cause what you call paresthesia on your legs. Okay. So look, even if he bends, it still avoids the 90 degrees or less than 90 degrees angulation. So this is actually a better leg position. So operatory chair. Well, how to look for a good operatory chair? So first, stability. So 5-leg base with casters is better. Okay, yung 5 paa. Okay, so yan yung because sometimes there are dental chairs who has only 4 legs. Okay, that's yung parang hindi siya parang pa-cross lang. And sometimes when you lean forward, when you lean too forward, minsan dumudulas na yung chair. Okay, so for stability, choose a 5-legged base with casters. Kung may 6, why not? That will be better. Lumbar support is also good. Okay, it will keep reminding you. Lumbar support is better than the back support. Okay, because back support, when you're having a computer chair, when you're using computer that has a back support, you tend to slouch more. Okay? But if it's a lumbar, it's in the lower, yung lower lang ang tinatamaan, more or less it reminds you to get back to the proper position. As you can see, this chair, medyo curved on the edge, on the front part, on the seat. The seat has a curved on the front part because it's more or less designed for a 110-degree seating position. Okay? So this is actually a assistant chair. Okay, it can also be used by dentists, but more on an assistant. Okay, because this is actually an armrest. Okay, hindi siya actually backrest. It's an armrest. Okay, so it is a little bit difficult to use for dentists because hindi masyadong medyo tumatama na sa chair pag masyadong malapit. So, more on assistant to kasi ang assistant doesn't really need to be close to the mouth. Okay? So, that's good for the assistant. And the assistant chair is higher than normal. Okay? Why? Because, as I told you in the early part, that the assistant should be higher because the dentist tends to face the patient towards him so he can see. And the assistant cannot see. Okay, that's why they tend to lean forward, or that's why a lot of times they are standing up. It's better for them to stand up so they could also see the inside of the mouth intraorally. So the chairs are also designed higher para mas madali silang tumingin. Okay. So these are 110, more than 110 degrees chair. Okay, so you can see the slant, the forward. It also has an armrest. That's good. That is very movable. This is a good chair, a very good chair with lumbar support. Actually, it completes all the what do you call this? The criteria. Okay. So this is the controversial. This medyo nakikurious yung mga tao. This is the saddle chair, okay? The saddle chair. You're just like you're riding a horse, okay? So this is actually, I was told that it's one of the best, this is the most ergonomically designed chair, okay? Not really, this design is not really for the boys because actually I'm using this one. Sometimes I'm choosing to the left side muna ba o to the right side, you know, the man parts. Okay, so that's why they designed something with the split. Okay, para gitna na lang. Okay. So saddle chair actually is very ergonomic. It stimulates and strengthens the back, abdominal, and buttocks muscles. Okay, that's why horseback riders can ride for a long travel. Kita mo nyo sa mga movies, sa gabi lang sila nagpapahinga, they can travel for hours without getting tired. Okay? Because it is an ergonomically designed position. Your posture will gradually correct itself as your muscle respond to the new posture. Okay? Remember, a lot of dentists bought a saddle chair, but pero ang sasabihin sa'yo, binenta ko, ang sakit, yan, hindi ako sanay, ang sakit sa katawan. Okay, remember, it takes time to adjust, okay? Because usually when you sit on a normal chair, it's your bone that's it's your bone that is being sacrificed. In a saddle chair, it's more on the muscles. Okay, that's why when you try to sit on the saddle chair, pansin nyo, not much muscle, not much bone is actually touching the chair. Okay, so give it time. If you use it every day, it will about 2 to 4 weeks. You will get adjusted, and eventually you will feel less tired during out the day. Okay, give it time. Hindi yan 2 to 3 days, first time nyo, it's your first time to sit on that kind of chair. Of course, it will feel weird. Your body will feel weird. Make your body adapt. Okay? Let your body adapt. But give it time to adapt. Okay? Saddle sitting improves leg circulation and reduces fatigue. Okay? Si Doc Lilian actually told me she can work the whole day without standing up with this kind of chair. Okay, the increased hip to knee angle takes pressure off the lumbar back spine. As such, it is very effective in preventing lower back pain. That is why I will show you the Keegan's position. So this is the Keegan's posture. Okay, they found out that if you do 90 degrees, you tend to bend your lower back more. But if you do the Keegan's posture where you're when you have a 135-degree angle, it tends to give your lumbar bone to its natural position. Okay? So, yung mas nabubuhat na yung long axis because there's 90 degrees, medyo mas malayo na siya sa long axis of the body. Okay? So, work posture should remain neutral. Operator's elbow be level with the patient's mouth. Okay? Okay, operator should travel around the patient. So sometimes, dahil nasa 8 o'clock position ka na, ayaw mo nang lumipat ng 12. So please, yung iba, some people, kasi madumi na yung wheels, okay? They have, what do you call this, rough flooring, they have dirty wheels on their chair, na ang hirap nang gumalaw. They're having a hard time switching position. So make sure they are clean. They make sure you have a smooth floor surface. Okay, so you should be able to move around freely. Okay, so 8 o'clock, 11 o'clock, 12 o'clock to 1 o'clock position. These are the most common position, but sometimes 9 o'clock position is also okay. That's a good. So I will discuss 8 o'clock, 12 o'clock position. So 12 o'clock position can accommodate almost all sides, but the use of mouth mirror. Okay, medyo technique sensitive lang siya. I know a dentist, I think Doc Chung Lai Chung, she doesn't move from 12 o'clock position. She can work all around the mouth on a 12 o'clock position. Okay, but she's very skilled with her mouth mirror. Okay. If you're very skilled with your mouth mirror, you can stay in a 12 o'clock position. Best for symmetry and aesthetics. Okay, it's not. 8 o'clock is very dangerous for aesthetics. Okay, because if you're looking from the side, you're stretching the muscles of the face of the patient on a different way, and of course, and also the perception on the patient's tooth is also different. So 12 o'clock position when doing aesthetics, best is 12 o'clock. Okay. Mostly used on upper buccal and occlusal surface for indirect. When you buy direct is direct vision. Indirect is when you're using a mouth mirror. Okay, lower anterior for direct vision, you can also use 12 o'clock position. So this is a 12 o'clock position. Okay, with the use of mouth mirror, you can achieve all sides. And direct vision for lower lingual anterior. Of course, when you're doing scaling, we all know that this is one of the most calcular deposited area, the lower anterior lingual. Okay, 11 o'clock position. So that's when sometimes you can use that on the lingual surface of the quadrant 3. Okay. On the third quadrant. Okay, 8 or 9 o'clock position can be used for quadrant 1 and 2 lingual surface. Okay, lingual surface, 8 o'clock to 9 o'clock position. Lower occlusal, direct and indirect, you can also use that. So this is an 8 o'clock position. You can easily see directly the lingual and buccal surface. Okay, 8 or 9 o'clock position, you can easily see the occlusal surface. Okay, 1 to 2 o'clock position. Okay, this is 1 to 2 o'clock. So I sometimes use this for lingual of the quadrant 4. Okay, so parang cross ang tingin mo. Okay, and of course, lower anteriors also very useful for lower anteriors. Okay, so after the position of the dentist, we will now talk. Okay, kasi medyo 7 o'clock na pala. Okay. Ang dami pa nito. Okay. So I'll just make it faster. Okay. Proper position for chair and patient. Make instrument tray accessible to the hands and eyes. Adjust the patient's head if necessary. Don't adjust for your work, but adjust your work for you. So this is adjusting for your work. Dahil nakaganon tingin yung patient, nag-adjust si dentist. This one is adjusting the work for you. Okay, you adjust the face of the patient so you will be easier for you. So this is what I'm telling you, that do not adjust for your work, but adjust the work for you. You can adjust the patient. Okay, patient can turn heads turn their heads 30 to 45 degrees comfortably. Meaning, it doesn't, huwag kayong mahiya. Okay? Usually, nahiya tayong iharap sa'yo yung patient. Okay? So, look at what happens if you don't let the patient face you. You're adjusting for your work. You're leaning forward. But if you adjust the patient's mouth, look, it's easier for the both of you. And remember, it's not uncomfortable for the patient. It is normal to go 30 to 45 degrees comfortably. Okay? Just do not reach more than that. Okay? And look at the vision. Okay? If you don't adjust the patient's head, you tend to retract the cheek more. Unlike when you adjust the patient more, it retracts the lips more lesser. Okay? That's why other dentists, kahit wala ka pang ginagawa sa patient, the patient thinks that you have a heavy hand because you're retracting the cheek more. But if you adjust the head of the patient, lesser retraction, yun yung sinasabihan nila magaan ang kamay. Okay? So do not be intimidated. Okay? Do not fix the patient on an upright position. This is a 45-degree angle. Look what happens. The dentist is carrying his whole forearm. Shoulder is working, arms are working, so the dentist will get tired faster. Okay, but if you adjust the patient leaning back, okay, it is still comfortable for the both of you. And again, madalas naririnig ko sa dentist, Doc, baka nalulunod yung pasyente. Okay, I work almost every time on this position, a very supine position, and patient doesn't complain. Patient doesn't feel, of course, out of 10, there are one or less than one who complains of being leaning forward, because more or less your reclining is a little bit wrong. Okay, if you recline the patient, you do it slowly and by stages. Do not go straight to the recline. You let it recline slowly or by stages. You can stop, then recline more, then stop, then recline more. Okay, tender loving care with slight touch. When I recline my patient, I always hold their shoulder. Okay, because when something's reclining, you feel like you're falling. Okay, but if you feel a tender loving care of a dentist or your assistant is holding the shoulder of the patient, it gives them a sense of comfort that there will be something that's catching them. Though it's like saying that, don't worry, I'm here to support. Okay, I'm supporting you. So it gives calmness to the patient. So the patient will not complain of being too much reclined. Okay. Chin should be slightly higher than the foot. Okay. This is your, what do you call this? This is your limit. Okay. If the patient's toes is higher than the chin already, that is the time that mararamdaman na niya that the blood is flowing to his head or to her head. So this is the, later I will show you a picture. Elevate the base elevate the base of the chair as needed. Sorry, after pala yan. Okay, more upright if working with lower anteriors and more recline if working with upper arch or anything. So this is just a tip. Okay, so we have aerosol box, yung inopen ng isang question. We have a limited movement. So as we tried, okay, using a face shield for the patient. For this is a different face shield, but this face shield is lighter and at the same time it's curved. It's covering the patient's mouth. Okay, more or less if they're aerosol, it goes to the ground, or more or less it goes to your PPE, and you're gonna replace your PPE anyways. You're gonna replace your gloves, so it doesn't. It's not different with the aerosol box, and it's easier because it can be disposable and it's easier to clean. Unlike the aerosol box, it can be a little bit difficult to clean. Okay, because you have to clean the angles or because if you don't clean that aerosol box, okay, it will be harder. It might contaminate the next patient. But this one, it's very cheap. You can have lots of this one. You can have 20 pieces of this one, and you don't have to clean it every time. The aerosol box, you have to clean it every time. This one, if you have 20 pieces like this, you can have 20 pieces of the day, then clean it after the day. So it's ergonomics. It's the same. You can still do your normal position, your 8, 12 o'clock position with these kinds of aerosol protection. Okay. Of course, it's not scientifically evidence-based, but as long as the aerosol doesn't go up, okay, it goes down. Okay. Anyway, the aerosol box also, it still has aerosol, it also goes down. So it has the same effect. Okay. And if it goes to the patient's body, doesn't change anything. It's aerosol box also does that. Okay, so this is what I'm telling you about, that the chin should be higher than the tip of the shoes. Okay, that's your limit. Okay, so if you do 90 degrees, you will have a hard time reclining the patient. You're sitting the 90-degree position. Why? Because if you're sitting on a 90-degree position, the dental chair will hit your legs. Okay. That's why if the dental chair hits your legs, you tend to raise the reclination. You tend to upright the position more. And if you upright the position, you tend to bend your elbows. If you bend your elbows, more effort, more fatigue. Okay, that is not the neutral position. But if you have the Keegan's position, or when you're using a saddle chair or the 110-degree chair, look at this one. Okay, it will not hit your legs. Okay, the chair will not hit your legs. You can recline the patient more. Okay, and you can achieve the elbow level of the mouth. Okay, that is very easy. And if I advise, the thinner the chair, the better. Okay, modern chairs are really not that ergonomically designed. They like to make it fat, make it wide. Okay. So the thinner the chair, the better. Okay. Remember, the patient will just sit there for a few minutes. Okay. And you're working with that chair for a long time. Okay. If it's a little bit thinner and less comfortable, the patient will not feel that discomfort, not that too much, because she will just be there for an hour or a little more. But that's a few times. You don't make it too thick that it's gonna be comfortable the patient. Remember, it's not really that needed. Kasi sandali lang silang nakahiga. Okay? Unlike you, if you have a very thick chair, na hirap kang umanggel dahil ang laki ng chair mo, you will have a more hard time. Okay? So the thinner the chair, the better. So the 12 o'clock position, as you can see, if it's lifted, you can adjust more. Okay, always position your patient at the topmost of the chair. Okay, if medyo nakababa si patient, okay, lagi you ask the patient to go up. Okay, usually it's very hard to tell the patient. Sabi mo, taas pa po. Usually bumababa pa sila. Di ba? So, you should just say, ma'am, lapit pa po sa akin. Sagad niyo po yung puwet niyo po sa angle ng chair. Okay. So, as you can see, look at the dentist position. Nakababa yung patient from the chair, parang lower. So, naka-lean forward si dentist. But if the patient is at the topmost of the chair, medyo mas straight yung likod ni dentist. Okay. So, lower lingual, as you can see, 12 o'clock position. So for lower lingual anterior, you can upright the patient's chair. Okay? Hindi na siya 90 degrees. And what's good about the 90 degrees? 90 degrees. What's good about the reclination? The water is on the throat. Okay? Don't worry, we have epiglottis mask. We have an epiglottis. It will block the water. The water is there. It's easier to suction. Okay? If you're doing a restoration and your patient is sitting like this, all water in the lower teeth, lahat yan nasa floor of the tongue. That's why you're having a hard time sucking, higop, mapupuno ng laway, higop. When you burr, there's always water. When you're doing your composite, there's always water because your patient is upright. if you recline the patient, all water is in the throat. You place your suction on the throat, near the throat, or usually on the retromolar pad, and everything, you just leave it there. You don't think about suctioning anymore, especially if you're working alone. Okay, it's very easy. Okay, in pedo, they also do this position, the knee to knee position, because all saliva is on the throat. Okay, it is more better isolation, better ano. So there was an advice by a professional, what do you call this? An ergonomic dentist. They call this the posture dontics. Okay, posture dontics. When you're doing the upper arch, it is best to be the upper occlusal plane should be 20 to 25 degrees from vertical plane. It is the best position in treating the patient. Okay. This one, people will think, nakakalula, masyado nakatingin sa taas. No, it doesn't. If you place a mastoid or the neck pillow, okay, it is comfortable to patient if you have a neck pillow. You cannot, if you do this without a neck pillow or the mastoid support, of course, masakit sa patient yan. He will exert more force. So, if you have a neck pillow, it is easier to lift the chin. Okay, to do this 20 to 25 degrees. So, place a neck pillow or sometimes dental chair before. They have this mastoid support. Okay, that is for the mastoid here. So, you can easily go up and down. Okay. So, this one. So, actually, dental chairs before are more ergonomic than today. Okay. So, yeah. So, dental loops. Okay, what is dental loops? Dental loops, yun yung mga for zooming. Has a certain depth of field. Remember, there's a certain depth of field that forced to keep your body straight. I will show you that later. Avoid getting near to the patient, especially when we are in a COVID crisis right now. Loops are very advisable because it keeps your body away from the patient's mouth. The farther you are, the safer you are. Okay, because if you tend to lean forward, you're closer to the patient. If you have loops, you have zoom. And loops have a certain depth of field. What do you mean by depth of field? There's only a certain area that is focused. Okay, as you can see, the orange area is the only focused area. If you go closer than that, the depth of field will move, so it will be blurry. So this will remind you to keep your body straight, to keep your face away from the patient. So it is very useful during this time of COVID. Okay? It will remind me, layo tayo. So sometimes, you think that you're far from the patient, but you're actually very close already. Okay? When you're doing small composites. Okay? So yan, as you can see, look at this one. Telescopic, a very long, might be hard to use because it's very hard, but 6 times is very good, actually. So make sure if you're gonna buy a loop, buy something that can achieve a very steep declination. What do you mean steep declination? Yung nakatingin talaga sa baba. Okay? Because, like this one, yan. It has an adjustable knob, nagsaslide yan, so you can slide it down, so you can really look down. Because some loops are a little bit too straight. Hindi ko lang yung steep declination niya. So, because of the less steep declination, what do you do? So, ano nangyayari? Nagli-lean forward ka pa rin. Unlike these adjustable dental loops, because it is looking downward na, you don't have to lean down anymore. You can keep your body straight. Okay? So, pati sa loops, you have to check ergonomic. Okay? There is what you call the Periscope. It is a pentax. Parang may mirror siya sa loob. So, it can do the steep declination better. Okay, if you're, I found one here in Singapore. It's actually very good. When I tried it, I was really standing up straight. Okay, and it's a comfortable space. So, this is what you call the Periscope. Parang may mirror sa loob to angulate the vision. Okay, you don't have to lean forward anymore. Of course, dental microscope is still the best. Okay. Look at the straight body. Okay. But of course, it's expensive, but it's actually good for practice. Now, the dental tray. Okay, sometimes we place our dental tray too high. Okay, look at the elbow of the dentist, too bended. Okay, tray too far. What happens if tray too far? Okay, longer procedure. Okay, mas malayo yung kinukuha mo ng instrument, it takes a lot of more time. More twisting of the neck, more body movement, more muscle, more fatigue. Okay, so kung wish lang natin na pwede yung ganitong position na nasa dibdib, it will be much easier. But of course, the problem is we have cords. Okay? The cords will hit the patient. So that's why you can bend your, your trays like this para the cords will not hit the patient, but it's still, the instrument will be close to you. Okay? Kasi ang pangarap nga natin sa patient is kung pwede lang nakapatong sa dibdib ng patient, why not? Diba? Yun yung pinakagusto natin position. It's very close, it's very fast, it's very quick. Ang daling tumingin ng instrument, okay? Unlike this one will also be helpful. I told you, dental chairs before are more ergonomics than dental chairs right now because it's very thin. Look how thin it is. The tray is very thin. And look, it swivels. Okay. So, look at the handpiece is on the side, but the tray is over the top of the patient. That is actually a deck. This is a deck. Okay. Right now, they don't design the chairs like this anymore. Yung meron man, it's very expensive. And look, because the tray is swiveling, okay, the instrument is closer to the mouth. Okay, even if you do the 12 o'clock, do look that the blue line is very, very close. Faster, easier, and more productive. Okay. So the patient chair, what do we find? Stability. Okay. Chairs before are very, very heavy. Okay, ADEX, the old brands, those are very, very heavy because it is stable. Okay, the new brands right now, paminsan gumalaw lang yung patient, gagalaw na yung mouth mirror, gagalaw na lahat ng instruments. So, stability. Pivoting or drop down arm rest, okay, as much as possible for patient ingress or egress. So, as much as possible, nasa slide yung arm rest. So, it will be easier for the patient to mount the dental chair. Okay, supplemental wrist forearm support for operator and articulating headrests. Okay, do not buy something that has a fixed headrest. Make sure it can go down, go up, and goes, okay, it's movable. Okay, hands-free operation. What do you mean by hands-free operation? As much as possible, the controls of the chair is by foot. Okay, avoid na natin yung lalo na during the COVID times, we don't want those pushing it with your hands. Okay, as much as possible, buy a chair that is controlled by foot. Okay, look at the chairs right now. Look how thick the tray is. That is very, very thick. Okay, the thick tray will tend you. What do you mean? What would happen if you have that thick tray? Let's go back a little. If you have a high tray, minsan, what do? Sisilipin nyo pa yung instrument. Aangat pa kayo. Titingin nyo, hanapin nyo pa yung mouth mirror, hanapin nyo pa yung asa na instrument ko. Kasi because you have a very thick tray and it's very too high. Okay? Next, the gray chair. Look at the gray chair. It's very wide on the shoulder. They thought that it's more, wow, it looks beautiful. No, big shoulder chair is not good. It will keep you far away from the patient. 8 o'clock position is very difficult with this kind of chair. Okay, do not buy a big, wide chair. Okay, remember, the patient will just sit there for an hour or less, but you will work with that for almost a lifetime. Okay, these are good chairs. Look at the left. You have a separate tray for instrument and a separate tray for the hand pieces. Okay, and look. This is what, because what do you mean? I forgot what this is called, the catapult type. Okay. It has a certain tolerance with the pulling. I haven't tried it. I cannot really recommend it because I haven't tried it. But look, they have two separate trays. That's a good tray. Look at this next chair. It has a wide tray where you can insert the long arm of the tray on the patient's chest. It will be closer to you. So all chairs can do this. If you can see properly, it swivels. Okay, all chairs can do that. Not much chair today doesn't do that. So look at this one, because we also want a table on our back. That's why they are working on an enclosed space so everything can be reached by hand. So rather than making the space bigger, they just make the chair swivel, or it moves on its own. Okay. Team tray movement with chair rotation. To avoid strained position, the operator is encouraged to avoid twisting or tipping, reposition the patient's head. This is so this is should be, your chair should be rotating. But I told you, not all chairs have this one. Our chair has this one, the ADEC. Yeah, see, you can go to 12 o'clock position to 9 o'clock position without too much movement on the operator's chair. So yan yung dati. So yan. Okay, so I said that. So center sink. So as much as possible, this is a good triangle of activity. Laboratory is near, instrument table is near, drawers are near, so everything is close by. Okay. This is for dental technicians. Okay, dental technicians. So they have an armrest for their hands. Okay. So 3Ps, posture awareness, positioning technique, and periodic stretching. So let's go to the important part. Now for the micro position. Okay. Micro position. Doc, lumalagpas na ba ako? Do we still go on?
Go ahead, Doc. Go ahead.
So this is the micro position. Look at the thumb, finger. So the far, if you remember the neutral position, okay, as much as possible, you go to the neutral position. If you go lesser than that, it will cause you more strain to your wrist. Okay, not for, okay. We have three grasps actually, the pen grasp, modified pen grasp, and palm grasp or thumb palm grasp. Okay, so this one I took it in the morning. So this is the pen grasp. This is what we use for writing. Okay, and some we also use this one for our hand pieces, the low speed and high speed. So good for delicate fine movement. Okay, usually used when force is not needed. So when you're carving, sculpting, composite, you can use the pen grasp. Okay, or handpiece. You don't need pressure for handpiece. If you're applying too much pressure for handpiece, more or less, your dull is burr or your handpiece is weak. Okay, good for sculpting, carving. So yan for handpiece. And when you use the pen grasp, use the right pen grasp. Okay, do not use your own pen grasp for how you write. Kasi look, the correct pen grasp can reach farther inside because of this. Look at the position. If you're using your penmanship pen grasp because dun kayo nasanay, look, it will hit the teeth more. So it will not reach too far back. Okay, I have a lot of students in undergrad who uses the handpiece like this. So I force them to practice writing with the good pen grasp every day. Okay. So they improved eventually. Now this is modified pen grasp. This is best for scaling. Okay, best when force is needed. This is what you do. Okay, more stable than pen grasp and is less strain to the hand and can use the fulcrum force better. Okay, you do not. Later I will show you the fulcrum force. So in pen grasp, you have a parallel of your index finger and your instrument. You have parallel long axis. Okay, and look at the back. The middle finger is supporting the instrument. Okay, unlike in the pen grasp, the middle finger is not supporting the instrument. It's more on the index finger and the thumb. While the modified pen grasp, the middle finger is supporting the instrument better. Okay. And look at the pen grasp. The pen grasp is in between the knuckle of the index finger and the thumb. While the modified pen grasp is on the finger, on the index finger, is resting on the index finger. So look, it is bent like that. Okay. It is hard to maintain the position on the modified pen grasp if you're using this kind of pen grasp. So look, this is a pen grasp, modified pen grasp, and you know. So if you're looking for stability, look at the stability of these two. Okay, I'm applying the same force. The modified pen grasp is on the bottom, and it's the more stable. Okay, pen grasp is not stable. This exaggerated pen grasp is not stable also, but the modified pen grasp is the most stable one. That's why it is good for scaling. So fulcrum. So you have the pivot point. It's good for pivot point, stability. You have control, better control, and protection from your hand. So most of the carpal tunnel came from scaling. So load is the blade. Okay, fulcrum is your ring finger or your finger rest. And force is your forearm, not your fingers. It's your forearm. So look, place your finger rest on the occlusal surface, then place your instrument, okay, then that's the time you movement. We have wrist movement, not finger movement. Do not use your fingers. Use your wrist for movement. I told you it's position, execution, not just position. You have to have the proper execution. So rock motion, so this is the rock motion. It is where you use your pivot, your fulcrum. Look at the ring finger. It's on the fulcrum. It's in the ring finger is on the tooth. Okay, that's why you do it sideways. Okay, in a different angle. This is the rock motion. You do rock it side by side. Okay, that is good for scaling. Okay, that will use lesser force. Look, I'm not moving my finger. I'm just using my forearm. Okay, it will what do you call this? Mas hindi kayo mapapagod, mas hindi kayo ma-strain ng muscles. Okay, so this one is the pivot naman. Pivot is, Okay, pivot is where you go up and down. Okay, rock, what do you call this? Rock motion is left and right. Pivot is up and down. See, as you can see, different angle, it goes up and down. That is the pivot. Okay, look at the fulcrum, no finger movement. Okay, do not do this. Okay, this is not good. Pansin nyo, when you're using this kind of technique, you're just scaling 2 to 3 teeth and you're feeling some pain on your fingers already, okay, or your wrist already. This is the #1 cause of carpal tunnel syndrome. Not #1 actually, but it's a big factor of causing carpal tunnel syndrome. So the palm grasp and thumb grasp used for big movement that does not need tactile sensation. Okay, best used for straight low speed handpiece and high back suction. Okay, so this one I also you can use it for retracting teeth. So this one is like your, what do you call this? I call this when I teach this, it's called this, sabi ko dito parang nagbabalat ka lang ng mangga. When you're skinning a potato or a mango, okay? So that is the palm grasp, okay? You can also use the pen grasp. Do not use the modified pen grasp because the pen grasp, you can the low speed is very heavy, okay? That's why you rest it in between your knuckles. If you rest it on your index finger, it will feel more heavy. So use the pen grasp when you're using the handpiece. Okay, this is for fine detail only. Okay, so do not use the modified pen during the handpiece. You can also use the palm grasp when retracting your cheek. And of course, when you're using your high back. Remember, high back suction has a very thick tubing. Okay, you need good force. If you're using a pen grasp here, you'll stress your hand more. So use a palm grasp and make sure you're holding on the right area. Do not hold it too low. Do not hold it too high. Okay. So hand instrument, what is our goal for hand instrument when you're buying? So overall shape and size, handle shape and size, the weight, of course, the lighter the better. Balance, I will show you the balance later. Maneuverability and ease of operation, ease of maintenance. Okay. So this one, of course, the Ufridi, they have a carbon steel, something like that. It's very light. Okay, and I like the friction. Okay, make sure all your instruments has a friction, a very rough surface where it will not slip your hands, because a slipping instrument is very strenuous to the body. Okay, some they use hollow resin like this. It's very light. Okay, sharp. Of course, make sure everything is sharp. So these are your elevators. Okay, I like the upper left, the lower left, and then the middle. The middle, I like it because it's rough. The the handle is very rough. On the right side, I don't recommend it. When I use this kind of elevator, it's very thin, it's very smooth. It tends to it hurts my hand actually. On the first try of twisting, it hurts my hand already. So please avoid the elevator on the right. Do not buy thin elevators. As much as possible, make it thick, make it light, and make it friction. Okay. So this one, they have silicone grips like this LM. I think LM series. Ayun, Doc Roche also has El Marte because this is soft, a little soft, and it's a little bit. The curvature is good. It's designed ergonomically, and it's actually light. Okay, very light. The one on the left, please do not use scalers like this. It's too small. It's too painful to the hand. Okay, invest in proper instrument. If you're investing in a good instrument, you're investing on your hands. Okay, so as much as possible, avoid on the left. The middle one is good. If you already have lots of the one in the left, you can buy it on the upper right. That is the one with the silicone. You attach it on the instrument, but of course it's a little, sometimes it slips. So it's better to buy a new instrument. So Ufridi, I like it because it's very rough. Those serrations has what do you call this, as a grit. It's like a sandpaper. May serration sa may grip na. And a balanced instrument is the blade should be on the long axis of the instrument. Okay, so if you have convention, if you're going shopping, you find this kind of instruments. Okay, mouth mirrors. The thicker the mouth mirror handle, the better. The one on the left is too thin. The one on the right is light and thick. It has stronger force. It's better. And this on the lower right, I bought it in Air Premier. It has suction. You can place your suction there, and it will suction the saliva while retracting the cheek or the tongue. So dial scalers. Okay, if you have dial scalers, you inefficient deposit removal, so mas mahirap pa kayo magtanggal. Dudulas lang, wala. Pag hindi pa sumabit yan, hindi na maganda yung handpiece, ay yung scaler na yon. So lower quality of work, kahit magaling ka, if you have bad scalers, pangit ang scaling mo. Okay, need for increased lateral pressure. Lateral pressure is very, that's, kahit even if you do the pivot and rock motion, you still have to apply lateral force kasi yun yung pagdikit ng blade sa ngipin. If you apply lateral force, it's actually very strenuous to the muscle. Okay, reduce tactile sensitivity because you cannot really feel the calcular deposits if it's too smooth, kung hindi na siya sharp. Okay, increased clinical fatigue, of course. Okay, how do you know? Visual inspection. If it's shiny, it's not sharp anymore. Okay, it should not reflect light. Okay, it should disperse the light if it's sharp. Okay, So how do we test? Sometimes we do this acrylic sharpness test. You place it on acrylic, then pick. You don't scrape the acrylic, huh? You just feel a resistance, then flip it a little. Do not scrape. If you scrape the acrylic, it will blunt your instrument. But this is a way to check if your instrument is sharp. Parang tick, tick, gumaganon siya. Okay? So how do you polish your instrument? Of course, you use whetstones. Okay? You just polish the sides. You do not polish the main curvature. Okay? The sides only. And it's not the instruments that is moving. It's the whetstone. This is what you call the whetstones. Okay? You slide it up and down. Okay? The instrument is stable. The ones that's moving is the whetstones. If you're gonna sharpen your instruments, okay, and I will not focus that anymore. So this is how you sharpen the instrument. Okay, up and down. Okay, make sure you have the proper angulation. So automatic handpiece, lightweight, balanced models, sufficient power. Make sure it's good brand. Built-in light sources. So, hindi na uso yung walang ilaw. As much as possible, may ilaw. That's why actually, if you have a light on your loops, it is better because you don't have to touch your headlamp anymore. Less contamination of COVID. The less you touch on the dental chair, the less you touch on the tray, on the less infection you can have. So if you have your own light source on your head, if you have light source on your handpiece, it is more you are more safe from the infection. Okay, angled straight shank, pliable light hoses. So when your hose, hindi na uso yung mga swivel, yung mga spring type na na cord. Swivel mechanism. Swivel mechanism is the one yung may pang adapter. Meaning you can turn the handpiece without turning the tube. You buy handpieces like that. That is very comfortable to you. Sometimes pag hindi swivel mechanism yung handpiece mo, what do? Ginagano mo pa yung cord or parang ang bigat-bigat ng cord kasi you're trying to twist the handpiece but the cord should be included. So, tinitwist mo rin yung cord. It will strain your hand more. So make sure better you may adapter para nagsiswivel yung handpiece. Okay? So handpieces should be well-oiled. Of course, well-oiled, less sounds, less vibration. Okay? Not retracting cord. The cord needs enough slack for a neutral, not bent wrist. Okay? Do not make sure na walang force when you're holding the handpiece. So, electric and air rotor handpiece. Look at this one on the right. Yan yung sinasabi ko sa inyo may swivel mechanism. There's an adapter. Okay? You buy instruments like that. Okay? Umiikot siya nang hindi umiikot yung cord. So, it's very ergonomically designed. So, electric handpiece, low speed but higher torque. Well, I'll show you just. So, this is an air rotor handpiece. Okay, look.
As I give pressure, you can see that the air rotor handpiece is slowed down significantly.
I don't have an electric
and so, yes,
handpiece.
Look,
sometimes nagsa-stop yung handpiece. Sometimes it stops, sometimes it's slow, it gets slower. And what happens? You apply force more. You apply force more strain to your hand. And when you're removing your crowns, it's very tiring. Pagod na pagod yung kamay natin. Pagod na pagod na yung kamay natin when we do crown removal. Okay? That's why it is advisable when you're doing crown removal or dissecting a tooth, it is better to use an electric handpiece. Look at this is an electric handpiece. Okay. So it will start to look how fast it is. It is finished. It is done. In less than 5 seconds, he was able to cut the metal. Okay, it will cut metal like what do you call this? Like butter. Okay, when you're doing this with our normal handpiece, it takes a lot of time. Okay, so electric handpiece is very ergonomic. But I don't suggest using that on restoration or because it's heavy. Okay, That's a disadvantage of the electric handpiece. It's heavy and a little bit expensive. Okay, gloves should be ambidextrous. Okay, so medyo common na to. We'll just skip this one because we don't have time. So I'll just go with the tips. Okay, use cheek retractor as much as possible. Cheek retractor will lessen the load. I use cheek retractor in all procedures. Even impression taking, I have cheek retractor. Except on complete denture, of course. If, just imagine cheek retractor is the best. Okay, look. Even I don't have to retract the cheek anymore. I only have to focus on retracting the tongue. Okay. So sometimes I bought this one also. I searched the whole Luzon area convention just for this. The bite block with a tongue retractor. Okay. Look, I have a tongue retractor, I have a bite block, and I have a cheek retractor. Look, I'm not holding anymore anything, and I can see the tooth clearly. No contamination, no, the tongue is not touching, the cheek is not touching. It will lessen the load, lessen the pressure for me. Okay? Hindi yung, sometimes you're retracting the tongue, sometimes your left hand is more work than your right because you're always retracting the tongue, you're retracting the cheek. Okay? This one, I don't have to. I can focus on doing anatomy. Okay? Okay, sometimes when we're placing TOEFL or matrix band or what do you call this, sectional matrix, when doing it on the upper, it's very difficult because we're using a mouth mirror. So we're using two hands. But we need two hands to place the matrix, what do you call this? We need both our hands to place the sectional matrix. But if we ask the assistant to hold the mouth mirror, it's too unstable. Okay? It doesn't, gumagalaw, laging gumagalaw. That's why you can use an intraoral mirror. Okay? The assistant can use the intraoral mirror so you can use both your hands in placing sectional matrix or anything that you're gonna use two hands for the patient's mouth, placing rubber dab or something. You can ask your assistant to place a intraoral mirror. Or if you're working alone, you can ask your patient to hold the intraoral mirror. Okay. Calisthenics, I don't think we have time for this one. Okay. A last tip of advice, the 20-20 rule. Every 20 minutes of looking something, you look 20 feet away for 20 seconds. It will relax your eyes. Okay, because a lot of time, especially the 20 feet, better if upright because you're looking downward all the time. So 20-20, as much as possible, it's up. Okay, and usually green is a good color for relaxing the eyes. So if it's 20 feet away, place a green board, then just look at it for 20 minutes, for 20 seconds. Every 20 minutes of work, 20 seconds looking at the 20 feet away. So that is a 20-20-20 rule. And this is the ball. Okay, this is what you call the ball. This will release the median nerve. So make sure your thumb and pinky finger, small finger, be as far as from each other as possible. Then you imagine there's a ball. Do not flex your fingers. Do not crumble your fingers. Make sure it is something like a ball. Then press. That will release the pressure on your median nerve. Okay, lesser carpal tunnel. I'm so sorry with my head cap. That's how I wear my head cap. So it will not ruin my hairdo. Okay, that's the British haircut. So this is the protrusion neck practice. So you protrude your neck. And of course, you retrude your neck every once in a while. If you're waiting for your light cure, you do your protrusion, retrusion. Okay, sometimes you flex your arms like this. Okay, if your patient is gargling, okay, and sometimes you can add tension on the flexion by closing your fist. It will add tension, so it will stretch more. So I don't have time for this. So please like and subscribe. Okay, a little message on my YouTube channel. You can show this to your patient to easily explain it to them. Don't worry, I'm not doing this for my practice. I don't practice a lot, so I'm not. I don't I don't like my practice to be really really big, but this is just for the patient's purpose. So please like and subscribe and share to your patients. And we have a webinar at 8 o'clock in PAED, so please do also attend that one. So thank you so much, and that's my ergonomic lecture. I'm so sorry, medyo mahaba pala siya. I just added lots of slides and di ko na compute yung time. So I'm so sorry for extending too much.
That's okay, Doc. That's okay. Hello, Doc. Thank you very much for the wonderful clinical tips, dental ergonomics. So basically, this is a basic thing that all dentists must follow. So Doc, medyo nasan ka ba? Hindi kita nakakikita. Doc RK, medyo madilim ka. Doc RK, we do have several questions here. This is very important. So we would like to show some questions. I don't know if you can read it there. Doc RK, nakababasa mo ba yung mga tanong dyan? You can escape that. Then, how about the periotome elevator? It has a very thin tip. Doc. Ay, nawala ang sounds mo, Doc. Nawala. We can... Parang hindi ka namin naririnig. Hello? Parang naririnig niyo po ba si Dr. Arky? I cannot hear him clearly. Yeah. Wala. So, what happened to Dr. Arky? Ang ganda-ganda ng presentation niya. So, we do have several persons that would like to greet. Dr. Corazon Nepomuceno. Magandang hapon.
Hello. Yan.
Yeah, there you go. Dr. Arky.
So, periotome tip, it doesn't matter kung ano yung blade. It's more on the handle. Okay. So, handle yung important. The tip doesn't matter. It's the handle. If you have thick handle, good grip, it's good.
Doc, another question from Dr. Presi CG. So, sorry, what is electric handpiece compared to our handpiece in the clinic, which is also run by electricity? So, those are some...
Our normal handpiece is run by air. It's air-driven, okay? Using the compressor to pump the air into the handpiece to make it work. While the electric handpiece uses voltage. It uses a motor, okay, within the handpiece. Okay.
So we have another one question here. So Doctor, may pinakita ka kasi sa face shield. Is it the same, Doc, as the dentist should wear? Kanina,
but I suggest yung face shield na malayo. May face shield kasing malapit masyado sa mukha. So I suggest yung face shield na medyo malayo from the face. If you're gonna use it as an aerosol block.
There's I think we will be entertaining Dr. Maria Elena's last question probably because Dr. RK will still be attending a seminar at 8 o'clock, so that is 14 minutes away. Dr. Maria Elena, Doc, can you read this? Doc, in case a patient...
vertigo. Okay, vertigo is recommended position. Okay, the reclined position, as I said before, there is 1 out of 10 cases that you have to adjust for your work. Okay, so not all the time you can recline the patient. There are very, very few. Let's say 5 to 8% that patients they cannot tolerate the reclined position. That's the time we are adjusting for the patient's condition. Okay, so it's very limited naman, but I'm telling you, almost every day I do reclined position and patient is not complaining. Patient is good and everything.
Dr. RK, we have somebody who would like to ask question, no, and but this is on a personal note. Yeah. So we're gonna join him in live stream. So may magtatanong siya, Dr. RK, ha? So ready ka na matanong nito, ha? And he is no other than our favorite doctor. Welcome, we miss na namin itong doctor na ito. Si Dr.
Idol Doc Jacob.
Narinig mo ba ako? Nag-hear hindi ho ako kasali dito talaga ha, pero saling pusa lang ho. So, siguro,
ikaw yung master, Doc, eh.
This is the only way para mabawasan yung kabaliwan ko because I've been a hermit for over 2 months now.
Kailangan mo ng kausap, Doc.
And of course, congratulations to the dental market in the Philippines. You did a fantastic job. You know, I've been listening all this time, and I could see, and I'm seeing already, right before my eye, the next most sought station of the video of the Archie. You know, it's very relevant that I've been seeing a lot of this dental ergonomics, and I'm sure that this is one of the things that everybody would consider when they go back to dental practice. You know, siguro nakikita niyo in internet, in the web, in the Facebook, everybody's already dying to go back to their dental offices. Ako, honestly, I've been hiding because I'm suffering from an asthma and a vertigo. Nung nakita ko yung vertigo, tatanungin ko nga sa'yo kung paano ipoposition yung sarili ko because for over 3 days I'm suffering from vertigo. Now, the mainstream question would be, not a question, this would probably be an advice to a lot of those doctors who would go back to their practice. Everybody's init na init to go back to their practice. Bago kayo mag-jumpstart ng practice nyo, bumalik muna sa clinic ang mga tao, practicein muna ninyo ang pagsusuot niyan, yung mga
doffing.
PPE na yan.
Doffing.
To be wearing the PPE and begin again your practice with all those protective garbs, di ba? Hindi naman ganun kadali na when you are wearing that, mainit because of the distractions of the heat, your dexterity will also be affected. Ang daling sabihin na this will be the pen grasp, the different types of grasp for the handpieces and the instrument. But what do you think would be the effect while you're already wearing all those protective garbs? So, ang advice siguro sa mga doctors would be, don't just go straight away to go treat your patients. The very first thing that you need to do is to maybe jumpstart your practice by bringing in the people and tell them and teach them how to do it, how to don and how to doff, how to assist with all those protective guards. And through that, yun ang magiging reason for you to be free from infections coming from the COVID. No? For those people who would want to begin their practice, the very first thing that everybody must do is to think about how you'll be able to make your practice COVID compliant. Ano ba ibig sabihin ng COVID compliant? Tignan mo na ninyo that if you will be protected properly well. Because the real protection should be coming from the vaccine. Even if you get the best protective garbs there, it will never be a warrant that you will be saved from infection coming from the COVID, the virus. So, yun. So, siguro there should be the next series here that Dr. Arthur would be, like demonstrating how to work properly with all those protective garbs, Pakita natin how would I be able to position myself really well wearing all those, bunny suits, PPE, and all of those. No? Kailangan na nga tayong ganun. So, hirap na hirapan natin i-negotiate yung katawan natin sa pasyente. How much more have all those, garbs in ourselves. So, huwag mo nang bumalik sa practice. Nakakatakot siya sinasabi sa mga Facebook. Di ba? Post nga ng post yung mga doctor. Kilala na si Dr. Durkin. Guys, Dr. Durkin. Everybody don't want to go back to their practice. All yun ang gagawin nyo. Don't begin your practice. Go back to your clinic. Practice.
With assistant.
Let's just do parang paano ba tawag doon? Roche, ano bang tawag doon? Mag-drill.
Parang nag-acclimatize ka. It's like acclimatizing with the current norms. So there will be a new norms, but you have to practice it on your own. So dapat alam niyo muna ang galawan, paano kung gaano kadaling kumilos. So that is very important. No, but as I said, no amount of protection, no amount of device, no amount of machine can really 100% protect us from this virus until finally the vaccines have been discovered. So this is really very important. Yes, Doc.
Roger, you cannot blame the doctors for resuming their clinic as quick as they want to, maybe because meron din naman silang other concerns why they are doing it. Emergency situations, recalls, and maybe the financial aspects of going back to the practice. But thinking about the whole process and moving forward, what do you think will happen if you rush yourself with a lot of oversights in your practice? hindi mo alam na lusutan ka na ng COVID.
Correct.
Kasi sabi ko lang ba to?
14 days pa bago
I
mangyari.
am not yet ready to resume my practice. My very best friend is resuming in July, and I believe resuming in on the 15th of June.
How about Dr.
To
Arki?
Prepare myself on how I will be able to make the practice compliant. So this is very good because you've been doing a lot of webinars.
Yeah.
So
So
the webinar taon, everybody will be given an idea of how to structure their practice to make it compliant with the COVID. Diba?
Yeah.
Iba-iba sinasabi araw-araw. Diba? Meron
Correct.
ayaw nito, meron na gusto nito. So, paano ba? So, this is the best time for you to think about ano ba talaga dadalhin ko sa kliniko? What machines is really good for me to be protected? At least, no? With the COVID.
Correct. So Dr. Jacob, you will be back by July. How about Dr. Arki? When do you plan to go on practice with all the necessary equipment?
We actually have to train our assistants first. Kasi assistants ang medyo, us, we are trained for infection control, pero yung assistants natin ang hindi ganun ka-trained. Kasi during college days, we are trained for 2 years or 3 years during our college days. And our assistants, hindi naman sila parang bara-bara lang yung pagdating nila sa clinic mo, gawin mo to, gawin mo yan. So it's not a proper training for infection control. Okay? That's why during we have a program, the Dental Butler. We train assistants, but kulang pa rin. It's just a 4-day program. Kulang pa rin yun. So when we're gonna go back to practice, we have to make sure our assistants are trained. Okay? Kasi baliwala yung galing natin sa infection control kung yung mismong personal natin is not highly trained.
Thank you, Dr. Arki. Pero bago kayo kakat ko muna kayo kasi ang daming gustong bumati dito. Pa-shoutout daw Dr. Marina SB, Dr. Arki, Dr.
Carlo, SB, Doc Ann.
Yan, Dr. Mine, kamusta daw? BFF, Dr. Jacob. Miss na miss ka na nila.
Hello.
So yan, so I think Dr. Arki, to sum up with your presentation, we've really learned a lot. Actually, ang daming may mga dating bagong luma, alam mo yon, bagong luma na hindi ina-apply ng mga dentista, kaya this is really also a wake up call that ergonomics is very, very basic. So we should all follow all of this ergonomics.
Pero madalas kakaligtaan dahil sobrang basic, hindi na napapansin.
So so again, sa mga dentist po, si Dr. Arki is the dental architect of Philippine Dental. So if you want to follow him YouTube, maraming salamat. I-follow nyo po siya. Ang dami pong matutunan, especially para sa mga masa. Dr. Arki, maraming salamat sa iyo. I know you're going to be attending another one. Any final message?
Thank you, Doc, sa opportunity. Thank you, Doc Jacob.
You're welcome.
To be commended by you. Ikaw yung master ko talaga, tsaka idol.
Okay.
Thank you.
Now we still have Dr. Jacob with us. So Dr. Mine Quirino said, miss you too, Doc Jacob. Hope to see you again. Dr. Ana Delia Maribay. Nababasa mo ba, Dr. Romeo, yung mga comment?
Wala. First time ko, hindi ko alam how they able to see that. Teka, baka nandito.
Okay, so Dr. Mine is watching you. She misses you. Dr. Lee Ellen.
Hello, Dr. Ma.
So, Dr. Maria Elena, Dr. Maribel Sumulong, Dr. Imelda Cabasa. Hi, Doc. Kamusta ka na? Dr. Anka Musfadul. Ayan, kamusta daw?
Hello, BFF.
But DFF. Ayan, so they really miss your presence, Doctor. So, kasi siguro ginawa yung COVID para makapagpahinga ka no?
Yeah. You know, actually, I think this already the new norm, you know. Congratulations and shout out to you because webinar na siguro ang the real next norm, diba?
Mm-hmm.
You would think about how you'll be able to get away with the infection or with the contamination of the COVID, social distancing talaga, and this is the real best alternative for you to deliver, you know, lectures, informations to the doctors. You know? Yeah. So the doctors now will be be glued to watch a lot of webinars. So, ang ano lang ngayon dito is, sana naman yung mga magwe-webinar, no? Hindi naman mag-webinar na lang, no?
Tama.
Webinar na lang. Let's just bring in somebody who could provide us the real information, yung information na magagamit natin sa daily practices, no? And at the same time, pagkatapos ng webinar, go straight away, magagamit, mapapakinabangan, hindi ma-drip away yung mga tao na, ano ba to, nalito lang ako, no? I've been watching webinar all day, no? At you would see na may webinar talaga na pagkatingin mo, maglilib ka na kaagad because alam mo hindi maayos. So,
Tama.
Pero ang webinar na napakaganda, I'm taking down notes which I will be using when I start working in the clinic. So, pagbalik ko sa clinic, this coming May 15, we will just restructure. After May 16, on the 16th, i-restructure lang namin. So, we are trying to work it out on how we'll be able to redesign the practice that becomes a practice of being a COVID compliant. So, ano yung mga kailangan? Ang dami ng webinar na nagsasabi, you need this. No?
So basically,
But then after with all this, kailangan muna, practice muna kayong lahat. Bring in the people, your team, that then be familiarized on how they would work and move, time and motion, anong klaseng effect ang gagawin nito sa movement ng mga tao. Because wrong move may cause so much to yourself and not only to yourself, to your patients as well.
Correct. So yeah, you're very much perfectly correct. So there should be a rundown of the system that you're going to run in your clinic. Just like, alam mo, Dr. Jacob, parang na-anticipate ko na yung mga ganyan dapat na ituro sa mga, of course, you're very much knowledgeable with all of the step-by-step. Just like this coming May 13, I will be talking about our new norm step-by-step from accepting patients to giving patients what they need to be given to them, what they should wear. So I will on our part, we're going to share the step-by-step process until na pumasok siya sa treatment room, hanggang siya sa lumabas sa kwarto namin. So basically, I will not be talking about the medical or clinical guidelines. I will just talk about the practicality on how to protect and step-by-step process on how we can protect ourselves and also protect our patients. Kasi tama ka, Doc, don't rush back getting back to your normal. So because definitely this is uncertain. So we're probably going to see certainty next year pa when the vaccine is discovered. Tama, Doc?
Yes. And even the structures of in every clinic of each doctors are not the same. Hindi sila pare-pareho ng design. Some are just a makeshift clinic. Hindi na pinag-isipan kung anong magiging design ng nila. Diba? Some doctors will just put a practice wherein a little portion of their house will be converted into a practice. So, paano natin ituturo sa kanila, how are we be able to make this clinic COVID compliant? So, yung nagle-lecture, ang discussion niya will only be about this size of clinic, this design of clinic. How about the clinics of other doctors that doesn't conform with the basic design of the clinic? So, dapat siguro yun din ang ipupunto na magle-lecture sa mga susunod na araw. Hindi lahat ng dentista kasing laki ng clinic ni Dr. na ganito.
Correct.
May aircon na dito nakalagay, ang bintana na andito, isa lang ang pinto, dalawa pinto. Paano hindi marunong na gano'n? Paano natin umpisa?
Okay, tama, Doc. So there's actually a lot of questions coming in from my Dental Marketing Philippines page. Na, Doc, paano po ito? Because, Doc, kasi for me, I've downloaded all the guidelines. Of course, we do have guidelines. I've read basically everything about it. And that is basically complete. That's what we wanted to achieve in every dental practice. Just like having a permit in practicing your business. Diba? So that is a standard. Pero a lot of dentists don't have permits. They only have PTR. So basically, doon pa lang po sa compliance of having a business permit to practice, hindi na nako-comply. So what more, this is a complete with all the expenses that needs to be done. So there will always be some silver lining or gray hole area in that particular, and some more. There are small clinics without being so offensive that they don't have really an exhaust system. So they don't have even a space to put up another machine. but they still need to survive in our everyday lives. So how can we be able to provide them certainty in their practice? So we really have to look into a deeper meaning of how we can protect each and every dentist that we really
And
love.
Roger, not only the space that they are looking for, they're also looking for the funding.
Correct.
Funds that they need in order for them to purchase all those sophisticated machines. Kaya nga, long before you purchase, the very first thing that you do is to keep on listening to the advices of the doctor. The reason why I would not go back to the practice as quick as I can be is because I would like first to find out what would be the result of the practices of those doctors who go back to their practice outright. Their experiences will be the one that will teach me later on how to restructure my practice the way it has to be.
Correct. That is a perfect example of what needs to be seen at the end, probably after 2 months or 3 months of dental practice. We'll never know. Maybe this is not to scare you, but this is just to warn you. Maybe after 3 months of your dental practice, probably May, June, July, there will be dentists who will die in COVID-19. Wag naman po sana, but we are just praying for the best. So this is really we, as much as we wanted to get back to norm and earn a living again, we don't have a vaccine yet. We don't have that much protection yet. And I said earlier, there's no amount of protection that can save us from this pandemic or from this virus. So we really have to take care and really have to look into the results of those who have opened up their businesses probably after 2 months or 3 months.
Yeah. We also have to teach the doctor on how to standardize all the fees after we put in all those materials and instruments and equipment in the practice. Paano tayo maniningil yan, di ba? So how to be able to charge on the very first day, pwede bang libre na lang? O okay yun? Then you have to condition also the minds of these people by maybe sending them feelers or maybe email or whatever kind of communications that you could send to them for them to be updated that one day when you go back to the clinic for treatment, there would be an additional fees that you have to be incurred because the doctor has already brought in a lot of new equipment in the practice.
Just like another perfect timing, another great opportunity for yours truly for Dental Marketing Philippines, because that will be part of my topic this May 13. And I've anticipated that, no? So that's why I will be sharing to my beloved dentist a new form. It's a pre-COVID form plus questionnaire, and I incorporated the consultation fee there. So doon pa lang, I will be presenting this on a step-by-step while they are filling up their information or their information sheet or the questionnaire. It is trying to imbibe or trying to really put into their mind that there is no such thing as free lunch today. So there will be an indirect information that there will be consultation, that there will be additional charges at the end of the treatment. Whether the treatment pursues or the treatment goes on and on with the treatment plan, you've agreed with the treatment plan, or you just visit for a consultation, you should extract some amount from your pocket. So I will have to touch on that a little bit. So those are the norms. Those are the things that we have to really adapt in terms of changes, Dr. Tama, Dr. Jacob?
Yes. So, dapat din, Dr. Roche,
yes, sir.
Dapat ceiling for what kind of practice the doctor is doing, di ba? So, kawawa naman sila kung ang mahal-mahal ng materyales na ginamit nila, tapos yung sinisingil nila is for the low income patients lang, di ba? So, kailangan din yun, meron tayong standardized fee for whatever kind of practice the patient is doing.
Pero doon, tagal na yung issue na yan. Parang hindi makontrol, no? So, this is just a discussion outside.
Pwede natin sabihin that the patient would look at it obviously. Nakasuot ng protective garb to, naka-double glove to. Meron stamp mat pa sa clinic niya. Kinukuha pa ako ng thermal scanning. Then, that could be one thing that may sway their minds that, magdadagdag kami ng bayan. But for orthodontist mo, ngayon yan, nakakontrato na sila. if they come to my office.
Yeah.
Diba?
Paano nga yun?
Ng monthly down payment nila. Paano pa sasabihin sa kanila, hoy, magbabayad ka ng panibago kasi nakasuot ako ng PPE. That's why we need to prepare. Ang haba muna ng preparation na gagawin natin to condition the minds of the people, maybe through mail, through text, or dun sa pintuan, maglagay na kayo, mag-post na kayo dun, mag-post na kayo ng note doon na, you know, with this situation, we will be charging an added fee for your baka magalit. Diba?
On that note, Doc, yeah, you stated na that you have already have treatment plan for several of your high-end patients, Dr. Romeo,
yes.
diba? And how do you plan to do it? Like sending email, text,
we will
like that?
email one by one. You know, a text message is already composed, an email has already been prepared, and we will be sending it one by one to our clients. Though with my practice, hindi naman yung nagiging mahirap because I chose a practice that is exclusively for one specialty only.
Correct.
Problema tayo dyan pag doon na tayo sa mga GP cases. Isang sabi mo lang sa mga pasyente ng ortho na there will be a specific additional charge of this. Naiintindihan naman nila yun because hindi lang naman ikaw lahat na, buong mundo na nag-suffer ng pandemic.
Correct.
The next question would be, magkano ba yung talagang reasonable charge for the patient for them not to be offended and be shocked, diba? Hindi lang sila masyasyak pag sinabi mo yung sisigil mo, they may die anytime soon. Diba? A couple of days back, I was listening to one lecture in the webinar. Naglagay na siya doon ng mga charges. Ito, idadagdag mo. 235 ata, parang 300 ata ang sisingilin mo for every patient with all those materials and equipments that you have used. Provided. That we provide. So, nag-uusap din kami. So, tama na ba itong 235 na ito? Ganito. Yung computation kasi based on the reusable.
Correct. That is,
labahan, sterilize, diba? So, magkakaroon pa ng dito kung disposable yung gagamitin mo, hindi lang naman ako magsasot nun, diba? Who else will wear that protective guard? Sinabi, one dental chair practice na lang yun, diba? And hindi na rin ina-advocate na 6-hand dentistry. So, yung assistant ka, pagsasuotin ko ng protective guard. Pagsasuotin ko na din siya ng Pampers.
Ang hirap kasi. So really have a lot of things to really to consider and a lot of work. But I'm more afraid of the rush of going back to a practice, Doc.
Natutuwa nga ako kasi couple of weeks back, ang daming mga doctor na nakikita ko, nagpo-post sila, nag-clinic na sila. No? Nag-clinic na. And suddenly, after nakita ko, ayaw nang mag-clinic. Then, it's already a good thing that na-awaken sila, nagising, no? Na hindi, ang kalaban natin invisible. Hindi natin kalaban ng patient dito, ang kalaban natin, the virus that is invisible. Mamaya dyan, malusot ka ng isang virus. Dyan yung kinita mo ng isang araw na yun, kulang pa sa papag-hospital mo. Diba?
Yeah. So, tama yun, Doc. Talagang as I always say in everything that every webinar, every people I talk to, no amount of devices, no amount of machine, no amount of PPEs can even protect us 100% from all of this virus. So, ang just like ganito kasi sa negosyo dito sa Pilipinas, kaya po Mr. Joey Concepcion have advised of opening up other businesses for GCQ. You know why? Aside from giving rapid tests to all the barangays on a per section basis, he, as a businessman also, as a government advisor for businesses, he wanted to see what will happen after a few weeks or months of opening up business. Whether there will be a pandemic on the barangay, there will be another surge of virus, or there will be no business at all because people are afraid to go to the restaurant, or is that restaurant gonna survive with only a few tables inside? So, meaning to say, they are going to analyze the situation after a few weeks or months. So the same thing is applicable to the dental business. Yeah.
It wait. Hintay muna kayo. Hintay muna tayo. Tignan muna natin anong magiging resulta ng mga practice na inumpisahan after the lock-up, after the lifting of the ECQ. Diba? Tignan natin, from there, let's pick up. Ako ganun ang gagawin ko. Nag-iisip ko nga kanina, yung reception ko, may dalawang malaking couch. Malaki na couch.
Yeah.
Alisin ko yun. Saan ko ngayon ilalagay yung couch na yun? Because I have to replace it with a monoblock plastic chairs para maging COVID compliant. Because hindi ko pwedeng plastican yung couch na yun. So, yun na ba kadali agad bumalik na pagbalik mo? No, kailangan mo na time and motion, practicein muna natin lahat yan kung paano tayo gagalaw sa loob ng clinic. I was listening kay Dr. Lea de Castro. There's a place for you to don and there's also a place for you to doff your PPE. Kailangan, alam mo, saan ba natin susuot ito? Saan natin ito? Kung ang clinic mo, kasi laki lang ng bahay ng Kalapati. Saan natin gagawin yun? Tama ba?
Yeah, so, tama po.
That is natin talaga aral, mabuti. Makinig. Sa Facebook, wag na maglagay ng mga kung ano. Let's just listen to the webinar, whether it's a local webinar or a foreign webinar. Kung alam niyo may magpupulot kayo doon, take down notes. Ako, look, araw-araw na ginawa ng Diyos, webinar, ang dami ko nang nasusulat. No? And from here, dito ako pupulot kung paano ko umpisahan yung clinic ko ng maayos.
Correct. No, tama. So, I'm also a lot of notes here. 15 mistakes of dentists, overspending, why so expensive, show your value and show your perspective. So these are the things that will really make us stand out, but don't rush back. No? So again, as I said, go ahead.
Kailangan daw ang clinic design should be minimalist, open and concept, right? So that the surfaces will be easily disinfected. Lahat ng mga nakapatong sa mga tabletops and all of those. So ano na naman, problemang malaki na naman, where are you supposed to put all those, di ba? So kailangan talaga pag-iisipan mabuti, hindi agad-agad. So ngayon pa lang, if you have the time, diba? Bumalik na kayo sa clinic ninyo, try to think and rethink paano natin to i-redesign in such a way that this will become at least compliant with the basics of what the COVID needs for you to protect yourselves and the people as well. Oh.
Yeah, kaya nga. So talagang it's just how it's a balancing act. So we have to balance it out, balance everything. And that's the only thing we can do today. And I hope this one ends, but the end is not so near. So those are the things that we really have to face.
Who knows ka iintayin niya meron na palang na-discover na vaccine. No, when the vaccine is already there, you don't need to buy all those protective cards at all. Hindi na rin kayo bibili ng mga machines na hindi na natin mapapakinabangan after. Though, mapapakinabangan naman, but then, makatipid tayo, di ba?
Correct.
Hintay ng sasabihin ng mga seasoned dentists who has been there and who has already started their practice. No? Huwag muna magmamadali, hindi tayo dapat magmamadali. Kailangan isip-isip muna because ang kalaban nandun, invisible, hindi natin nakikita.
Yeah, so we truly understand each and every dentist situation wherein if this is the main source of income, we truly understand. And of course, we appreciate your willingness and eagerness to get back to work. But really, it will definitely more painful if there will be uncertainties that will happen to you and your family. So it's just a matter of your decision. We are going to provide you more information as much as we can, but at the end of the day, you are going to make your own decision. So
shout out to Dr. Pee-wee Andida Lab. You know, she's a very good friend and she's been practicing for quite some time now and she's doing a big practice. Pumasok na yan sa isip ko with Dr. Pee-wee because she operates on many chairs. Diba? Maraming dental operators, dental units. O ngayon, ang sabi, isang chair na lang, we operate on a one chair basis, and the gaps would be 30 minutes for each patient for you to be given the provisions to disinfect your clinic. Diba? Isang pasyente, disinfect, isang pasyente, disinfect. Ilang pasyente ang pwedeng gawin sa isang umaga? Baka 3 na lang.
Correct.
Sa hapon, 3 na lang. Then, kahit na malakas ang practice mo, babagsak ka rin, it will affect you because paano yung kita mo in a day, di ba? But that's gonna be the new norm. Mag-a-adjust na tayo dyan. And that's gonna be one thing to study kung paano natin i-digest na in each day, tatlo, 6 lang ang gagawin natin pasyente.
And at the end of the month, you're still going to pay for the expensive products, rental fee. It will never change. So there must be really a shoot up. Not 100, probably not 1,000% in your charging, but there should definitely an increase because we cannot survive with 3 patients a day. Maybe Dr. Jacob can survive. Maybe Dr. Kelilo can survive. 3 patients a day will do, or probably 2, 3 a month. But most of the dentists that we cannot survive on that. So really, it's just a decision that you have to balance it out. And we are just here to provide you more information for you to be able to really get a lot of wisdom and make a better decision, an informed decision. But we just hope for the best. Basically, that's it.
Now I could see doctors are looking for other fund sources. Diba? Nakakalungkot yung isang dentist kanina, she's on the Facebook na lahat daw ng dentista ngayon nagtitinda na. Could you blame them na naghahanap sila ng other fund source? If I'm also on their shoes, baka mag-isip din ako na magtinda ng paritaw o banana cue kung ganyan ang buhay ko. It's as good for you to comment that bakit nagtitinda to. Ang hirap ata na wala tayong kinikita a day. So, looking at that scenario, ang daling magsalita di ba? Pero paano kung ikaw pala yun na wala ka na rin kinikita a day?
Yeah, so talaga mahirap.
Other fund source, no?
Okay. Makinig kayo kay Dr. Jacob, makinig kayo sa akin at baka may pagkakakitaan tayo. so ganito, no? But dentistry will always be there. This is my personal opinion. Dentistry, last 2018, I was doing a lot of research because my book will be coming out this July, supposed to be, for 2020 issue. I've Met Stupid Dentists. That's the title of the book. Dr. Romeo Jacob has an article there. It's been there for almost 1 year already, and it was never released. It was never published. So makikita nyo lang po exclusively in my book. The title of the book is I've Met Stupid Dentists, a dental marketing book. Naku, magugustuhan nyo po yung librong yon. 2018, Doc, I was doing a lot of research, and I found out that for the coming 5 years up to 2024, dental business will have a compound average growth of 6.4% every month, every year. So meaning this is a great business, but before this pandemic. So I'm not going to warn you. I'm just not going to scare you, but I'm just going to warn you. But at the same time, I don't want you to lose focus on being a dentist in your dentistry procedure and practice, because we are going to get back. We are going to get back strong, Doc. So my advice is keep on, hang on. You're going to be a dentist forever until you die, and you're going to earn money again. Don't worry, but don't rush to get back to normal.
Closing na ba tayo?
I have more time for you because a lot of doctors misses you also. We can.
The advice is when you get into the practice, when you return to your practice, treat yourselves as a dental student. Para kayo ulit dental student, right? Be like a dental student again. Para kayong first time nagiging clinician, and the first time kayo magsasok ng laboratory or clinical clubs. This time, hindi lang isang glove, double glove. Yung movement, dexterity, ergonomics, the movement inside the clinic, how you deal with your associate, your assistant, no? The movement from the operatory to the laboratory to the pantry to the reception. Ngayon, yun ang inaaral ko, paano. It's good that I get two doorway, isa one on the left and one on the right. That's exactly what I was thinking. Pagpasok doon ng pasyente, iba din ang lalabasan ng pasyente, so there would be no contamination.
Ang hirap.
Sinasabi ko nga, Paano ngayon kung ang clinic natin, isa nga lang ang pintuan? Diba?
And most of the clinics are there, though.
Balik lang ang clinic natin. Yun ang gagawin natin ngayon. The webinar people will now start working on how they would teach the doctor to begin, right? With a little piece of space para makapagtrabaho ng matino na they are a little more confident that they are complying with the COVID standard. Not only for themselves, but also for the patient. Diba? Ganun ang gagawin natin ngayon. Sa kanila, ito na rin, itong awakening to. This will probably be a door to open the minds of the doctors. Habang ngayon, imbis na nagpe-Facebook kayo, imagine niyo yung clinic nyo. So,
Yeah.
Anong aalisin nyo, anong pupunasan nyo, anong ipapasok nyo sa aparador, anong ipapasok nyo, anong ipapamumunas nyo, anong tatapakan nyo, sinong associate o assistant ang hindi nyo naman na papapasukin. Diba? Magbabawas na rin tayo ng tao because the social distancing must have to be observed there. I got 8 people in my office. Ngayon, pinag-iisipan namin, baka 2 na lang muna o 3 na lang ang papapasukin so that they will also be free from contamination just in case there will be. After all, iniisip namin, baka nga 4 lang sa umaga, 4 lang sa hapon. Ano pa gagawin ng isa? Makakontaminate lang siya. Ang daling sabihin din ito, pero pag inisip ko, saan naman kukuha ng kikitain yung isa na yun pag hindi mo pinasok? Kaya yun ang mga dapat din natin aaralin. Hindi tayo basta papasok ng tapos sasabihin natin, wala kang ibabayad sa'yo kasi wala tayong kinita ngayon. That's unfair. So, kailangan natin bago tayo bumalik dyan, naaral na natin lahat ng logistics, yun, nalaman na natin lahat ng magiging protocol sa clinic. It's never too late. Ang dami pang time. If you're thinking about resuming on the 16th, go. Ngayon palang araw na to, ngayon gabi, muni na ho kayo. No? Text nyo na yung mga kasamahan nyo dyan sa clinic. Paano natin i-restructure yung clinic natin mabuti in all aspects that will yield into possibility. Diba, Roche?
Yes, Doc. Tama yun. So, just like us, we do have...
Kevin.
Yeah, Dr. Kevin. So, Dr. Kevin will be doing a lecture on May 10. Now, hi, Dr. Kevin. And, hello, Doc. Naririnig mo ba ako?
Yeah.
So tama yung sinasabi ni Dr. Jacobs. To all the dentists who are watching right now, we still have a lot of dentists who are watching right now. Thank you very much for staying in. Just like us, we have probably visited our clinic 3 times in Las Piñas, 3 times in BF. You know what we do? We just imagine if this, then we move it a little. So we are trying to really find the best possible solution to keep the social distancing, to really comply with some other protocols. Of course, we are honest enough that all the listed guidelines, 101%, probably we can only comply 99%. There's no way that we can build another negative pressure and we build another motor outside. So those are the things that will be a burden in terms of really coming up with supporting all the guidelines. We really cannot. No, we are very, very honest to ourselves, but we are making so much progress in terms of protections, in terms of reassessing and moving everything in order for us to have a still safe dental practice. So I'm pretty sure. No.
Roche, since you'll be doing another lecture, it's very soon. When will that be?
May 10, there will be a lecture of dental digital marketing that will be presented by Dr. Kevin. So this is a way to really connect.
Anong topic ni Dr. Kevin?
The how you brand yourself and connect it with your patients using digital marketing, social media, using the platform. That's a very good topic, Doc. So
yeah, that's a very good topic. So that's one way for you to entice your patient to go back to your dental practices. Siguro gagawin natin kung willing si Roche or whoever dental architect ang kailangan niya. Maybe the people here listening, you maybe would want to take photographs of your clinic. So, kuhanan niyo ng litrating clinic niyo, ipadala niyo kay Roche o kung sino man ang ka-partner ni Roche na dental architect or dental engineer, so that they could give you an advice. Ito lang po ang itsura ng clinic ko, this small or this medium size or this big. Ito po ang magiging design nito. Because hindi natin pwedeng makuha ito sa salitaan lang. Hindi natin marunong mag-imagine.
Correct. Dr. Romeo Jacob, I don't know if you have the power to read minds. I don't know visual and the connection you have in my mind. You know why? Because I have a sister who's an interior design, at the same time have background with structure. That is already on my mind, and I'm going to advise it to all of the dentists. Not all, because I only accommodate some. Because I said earlier, I've read all the guidelines, and these are the things that would be the new norms. And I will be basically talking to my sister on how to arrange and fix all of these things. Parang na-advance mo na yung iniisip ko daw.
I was listening to one webinar, and the speaker happens to be Dr. Leo De Castro. And he promised that he would take photographs of his office as soon as he already restructured. And I was also thinking about that as soon as I'm over with the restructuring of my office, maybe I could take a photograph as well, so that I could also show to the people and how I did it to be at least a little more COVID compliant office. But then again, the same question goes back to yung clinic ko, hindi naman kapareho ng clinic ng ibang tao. That's why we need to come up with a prototype clinics, ano yung mga prototype offices. Itong size na ito, na nandito ang dental chair, nandito ang bintana, nandito ang position ng aircon, ito ang entrance, ito ang reception. Through that, magkakaroon ng mga idea yung mga dentist. Siguro, 4 na prototype of office, 2 dental operatory, 1 operatory, 3, may separate na cubicles, walang separation of cubicle, ang isang reception, kasama na rin ang countertop niya, nandun na din, di ba?
Correct.
Ang clinic na to, meron ba to? Then from there, we will be able to come up with a consensus. This is exactly how I would like to design the office based on the model. Ito yung model na pinakita ganito. Kaya marami pang time. So, nagayon niyo pang time para isipin kung paano niyo gagawin yung clinic niyo na maayos.
Correct. So, really hoping for the best. Everything. And also, Dr. Jacob, I'm also hoping that you can recover fast. So,
I was away for quite a while. Nagkaroon ako ng mild pneumonia, okay, before the COVID, that progressed into an adult onset asthma. That's why I wasn't able to come out and attend some webinars like this. Gusto ko nang bumalik sa clinic ko to see how I would be able to make some improvements there. Tanong lang ako ng tanong sa mga company, no? Ang kulit ko, what is this HEPA filter? Mga ganyan, aerosol na ganyan, UV lights like this, aerosol shields, PPE. Yung mga tao, bilihan lahat. Kita ko, nagkakandara pa sa kabibili ng mga materials na ganyan. Pwede ba bago kayo bumili? Tingnan niyo muna kung talagang nasa ayos yung binili niya. Baka mamaya nagsayang lang kayo niyan. At the end of the day, you would realize na hindi pala siya cost efficient. Tingnan muna, magtanong muna. Yung iba, sinukat na, pinakita na, sinukat na doon sa Facebook. Sinukat nyo lang yan, pero hindi nyo pa yan tinesting the ergonomics of wearing all those. Diba? Punta kayo sa clinic ninyo, sa bahay nyo lang yan sinuote. Doon kayo sa clinic, check nyo how it would work for you.
Correct.
Aircon, isuot yan, how much temperature do I need? Diba? Baka mamaya, yung paglagay nyo ng pulse oximeter, nag-desaturation na kayo kasi sobrang init. Then isa din yan sa mga aaralin nyo once you get into your office. The temperature of the clinic, maglalagay ba ako dito ng exhaust fan? Do I really need the negative pressure? Pag may negative pressure ka, wala ka palang pagbubugahan ng
buta.
Diba? Ang dali-daling sabihin ng mga negative pressure na yan. Kaya lang makadali sabihin na I would convert my clinic into a negative.
Saan ka bubutas?
Saka may negative. Kasi mapapalabasin yung positive, yung buga. Kung ang clinic mo, wala naman palang lalabasan. Diba?
So those are the...
Inaaral ko. We've been talking gabi-gabi. Inaabot kami ng alas-2 ng madaling araw ng isang group. There are groups of doctors. 60 kaming lahat. Nag-uusap-usap kami. Ito bibilin. Katapos-tapusan ay ito bumili after doing a lot of comparative studies on the equipment. Yun ang importante doon. Hindi ka basta-basta bibili. Aralin mo munang mabuti yung bibilin mo para wala kang itatapon.
Yeah.
May display ka sa clinic mo but it's not working. Diba?
Correct. So yeah. So, yun nga, I think it's time for us to say goodbye for tonight. But I think we're very, very lucky and very happy to get to see my favorite doctor's long hair, gain weight.
Magkano ba ang ano ko dito, ang talent ko dito?
Dok, ang
ABS-CBN
ang PDA 2.5, nag-increase ng 3.5, di ba? Siguro ngayon, pandemic, thank you lang na muna.
Nagbibiro lang naman ako kasi saling sa akin naman talaga dito eh. Nagbibiro ako, bigla mo ako. But I'm sorry, I was able to connect again to my very good friends. Sa lahat mo ng mga kaibigan ko sa PDA, maraming salamat for listening. Warmest hello po sa inyong lahat. I hope you all stay safe. Stay safe po kayo lahat. Kung maaari lang po, wag muna kayong lalabas. Ha? Ang kabilin-bilinan ko din sa mga tao, huwag kayong lumabas on the 16th of May because that's the time we're in. The virus would probably be lingering around because lahat ng tao lalabas.
Tama.
Yan muna kayo sa lahat. Yeah? While you are inside, you are doing your solitary, magbasa, mag-isip, imaginein ang clinic, think about your staff, paano nyo sila mag-protectionan, iisipin nyo din kung paano nyo sila bibigyan ng compensation during this time of COVID crisis. Huh?
Correct. So again, Dr. Jacob, thank you very much sa pagkakataon na binigay mo sa amin, sa oras mo.
Salamat po.
At ito po yung aming lecture sa May 10. Abangan niyo po si Dr. Kevin. Maraming salamat. We'll see you again May 10. I hope we will still have Dr. Jacob on May 10 so that we'll have more conversation.
Pwede makigulo?
Pwedeng makigulo para makita natin kung nag-diet na si Dr. Jacob in 3 days. So I hope you are better. You feel better after 3 days, ha? Thank you very much. Maraming
bigla akong gumaling kasi narinig ko yung mga tao, nakita ko yung mga messages.
See?
Salamat sa inyo.
Dapat talaga nagwe-webinar ka na tanggalin na yung asmang yan. So kailangan mo lang magpahinga talaga. So again, thank you very much Dr. Jacob. So I'm going to say goodbye to you tonight. But for those who are watching still 5 seconds, I'm inviting you for May 10 dental marketing, dental digital marketing, social media branding for dentists. Makiconnect sa iyong pasyente, you do teledentistry, you do a lot of connections with your patient and you're gonna learn a lot and you will never be running out of business. Again, thank you very much. Maraming salamat po sa inyo. Good night and keep stock in Dental Marketing Philippines. Thank you.